if they're a success, it don't mean shit to me. At the end of the day, though, I just want to stipulate the fact that you have a mental issue. Like we're going around in a circle talking about pirates and all of this other shit. If you went to the doctor and said, "Look, I'm not happy with who I am as a person. Please give me some drugs to make myself happy," that is literally that's by definition a mental issue. There's no way that you can change that. I'm just stipulating a fact. It's not like the transgenders didn't go to the World Health Organization to fight for that. So we know that that's a historical fact. If you don't know your own history, that's your fault. So there is mental issues that derive from also chemically imbalancing yourself and taking hormones that's not natural to your body. If that's not the case, then women wouldn't have postpartum depression after pregnancy. It's because their hormonal imbalance is off, which causes a chemical imbalance. Anytime that there's a chemical imbalance inside of your body, that means that the level of percentages, and I don't know the direct percentages it is because I'm not in the medical field, but the percentages of every man, they have a certain percentage of testosterone levels that they're supposed to have at a certain age. And they have a certain level of estrogen. Same thing vice versa with women. They have more estrogen than they have testosterone. We all have all of these chemicals, but when they're imbalanced is when they're off. You guys are chemically imbalancing yourself on purpose. That means it will cause mental issues. There's no doubt about that. If my kid came to me simply at any age, and then my son is an adult and says, "Hey, I want to be a pirate," I'm going to suggest that he gets mental health. I'm going to suggest that he go seek a professional and talk to that professional before he cuts off his arm and creates a Captain Hook arm. That's just, I think that should be just a normalized thing. And if you have a kid, and I don't care what age they are, and they come to you and say, "Hey, I'm not happy with who I am as a person. I think that I want to cut my dick off." I think that they should seek medical health, mental health years before they do this situation, even if they're an adult. This is simple. That's it. You can unmute.
Organic.
The chat going
Mm-hmm.
crazy right
Um,
now, sister. The chat going
organic.
fucking
It
crazy
just
right
it
now.
just
Mm-hmm.
behooves me how
Mm-hmm.
people can say, "I'm tired of these tranny conversations lasting an hour," but still sit over there, but ain't changed the topic. Um,
Mm.
It
I'm just real
behooves me
confused by this.
to be calm when
It
people
behooves me.
misuse the word behoove. Y'all gotta
I'm
stop
fucking
doing
It
that.
crying.
behooves me when Kente Mete want to get in my mug. Now shut up, Kente.
I fucking can't. Well,
I mean,
I'm just not down with.
I don't find
Hold on.
okay. I don't find anything
I'm not
wrong with
down
who's
with the
having the
talking
comments
next?
conversation.
about my
I don't
son
find
and my
anything wrong with
kids.
having the conversation. I think that there
Okay.
needs to be these
Well,
conversations.
for sure.
Um, because first of all, there's some education that needs to happen on both sides.
For sure.
Mhm. Both sides, because I guess people feel like because it's their experience that they hold the authority on it, and that's not necessarily the case. That's also a faulty idea, set of ideas as well. So I think that we should continue having the conversations. I mean, I used to think like that too, but I just think that we need to continue having the conversations, because I think at least for some people are new when they come, they're new to our group of people having these conversations, and I'm willing to bet that somebody learns something new every time that we have these conversations. So I
Mm,
say continue having the conversations.
I do
I
learn
agree.
something new
I'm
every
I'm
time.
okay
I
with
say
I
changing the
educate yourself.
mean,
topic,
all right,
honestly, because
who's
I
gonna
know
get
a
to
lot
talk
about
right
a
Educate
lot
now?
of
yourself and be
different shit.
irritating.
Oh
Why
my
why
Somebody
gosh,
asked
the
Super
the
her
topic is
opinion.
a
Shut
bunch of
up, Super.
nonsense. Whose turn is this to
You
talk?
shut
I
up.
had my hand up.
Shut your ass
tell,
up, Troller.
I'm so
tell them again.
curious.
Tell
And
them
and
again,
that's the
Super. Tell them
truth,
again.
guys. Like,
Okay,
I'm cool with talking about
Clear it
something
from your
totally fucking
treadmill, Super.
different.
Tell them again.
Because it's not like
I'm
anything
still.
anybody says on this panel is going to change my existing setup. It's not. So it's really not no point in really
Oh
debating or
my
talking about
god,
who
Why
I
do you
like,
am
think you
because
matter
nothing
that
is going to
much?
Why do
That
change.
no
y'all
matter what the
always
fuck you
bring
got
this
going
shit
on in
up
our
and then
lives, we're
tell us
gonna
But
nothing?
change that
Kente,
because we ran into you. Sir, you are not that important.
but
No
You're
to the
not
offense.
same
gonna.
No,
point,
I'm just
Hey, I
saying,
just
like,
want you
but
to
to the
know
same
that
the
point,
way
you're
I'm
that,
saying
also
that
the way
not
people
going
that,
to
as
change
well.
my opinion about you
Um,
being
Kim.
abnormal, neither. You're
and
also
I'm
not going
fine
to
with
change
that.
my
And
opinion
we're
about you
in
being
America.
abnormal.
I think you're in
Okay.
America, bro. So you're
Well,
allowed to think what you think.
one of us was definitely trying to convince the other one that something was normal. Then I was never trying to convince you to change ever at all. You brought
Well,
this
I'm just.
conversation
I
up
mean,
to
my
talk
life is
about
normal
yourself
to
because
me,
you
though,
like
bro.
hearing about it.
It's
And
not
I've told
normal
you
The
though.
my
You
fuck?
opinion,
gotta.
just like everybody else in here. And we asked you a question. You felt offended about the questions. So just know that you're not a victim
Transgenderism is
here. I
not
don't understand why you guys
normal.
I
do this
never
shit.
said
Not
that I was
Why
a
y'all
victim.
normal.
I
bring this
can't. I
shit up
can't
and
be a
then get
victim to
mad?
anybody on this app. All
No,
right,
but
that's
you
Yes, you
that's
acted
can.
that's
like
for
a
Oh, yes,
sure.
you
victim.
can.
Like, you know what
Yes,
I
you
mean?
Acted
No,
can.
I
like
really
one.
genuinely I can't. Like, I don't know
You
if you was
can.
here earlier, but you know what I mean?
You want
Listen,
it to
in real
be
life,
all of us
this shit don't
attacking you
matter.
so you can sit here and
It
defend
does matter.
your community and what you
I'm not
stand
here to
for,
defend
and
my
you can start
community.
to
I just
speak
don't like
on
the
all
fact
of
that you
it,
were
and
saying
it can
saying
turn
some shit about my
into
kid.
an informative
Yeah, you
panel
didn't have
on
to
the
say nothing about his kid
LGBTQ community. That's how you want
But
it to
she
go.
don't
Okay, I
Exactly
gotta
how
acknowledge
it's
say
that.
going
something.
now.
I
kid.
started
I
calling
don't
her ass
Can
believe
I
eating
say
bitch
something?
that
when she
we
started
need
I
talking
got a
to.
about my
question. The
fucking
gay
kids.
person.
No,
No,
and
we
It
to be
don't
respect
matter
that.
fair,
We
if I'm a
respect
part
that.
of the
We
I
respect
don't,
that.
LGBT
and
community or
We
you're
not.
don't
not
like that.
I don't
wrong.
give a
We don't
fuck,
like
Taylor.
Taylor neither.
No, your child's
I
not
don't give a
normal
fuck. At
because
the
his
end of the day,
parents
And
Taylor,
we
I
are.
don't give a
definitely
fuck
don't.
Taylor,
about
you're
what
There's
not
part of
no
community
normal.
saying
I
that.
You're
am.
not normal,
I will
Taylor.
die for my fucking
You're not
kids,
normal.
and you're not going to be running
You
your
got water
ass
on your
eating lips
forehead. That's
about
I'm
my
not
not
fucking
saying anything
children.
that's
wrong. Y'all some motherfucking
That's
bullies
weird.
in the
What's
Hey,
going on?
I'm
Why,
I'm just
LGBTQ
saying, Taylor.
how did
community.
we
Taylor, you
get to
got water
Y'all
on
Shut
your
want
your
to do
forehead.
ass
this
You're not
weird
eating
shit
normal.
and
lips.
then try and
No,
bully
shut your
somebody for
ass eating
speaking on
lips
how
But
because
it's
you're
of the
not
fact
defending
that you were
normal.
speaking
somebody.
on my
That's the
fucking
You're
Stop
kids.
motherfucking
trying to
problem
make
I got
but
us
with
but
y'all
eating
listen,
lips
motherfucking
a
wait,
thing.
Candy,
conservatives.
I
It's
got a
It's
not
quite
question.
going to
Candy,
frankly,
be a
no, we
thing.
Candy,
At
don't
the
need to
pause.
be
end of
Candy,
the
I got a
day,
talking
question. I
you
got a
should have
question. I
never
got a
made
this
question.
that false
weird.
as
Order in the
equivalence in
court.
the first
The
place. You
fuck?
was the one in here
Excuse me.
talking about,
Can
oh,
I,
you
I have
wear
a
wigs?
question. I got a question.
That's
I got a
just like
question.
God
I got a
being
damn, how did we
question.
get
transgender.
here?
No, I was saying all
That,
that
that
and
and
you
you
list
be
like
so
apple
changing by
bottom
yourself.
crazy.
pants?
Um,
Nope.
Nobody,
You're just like
nobody on this
transsexuals.
panel.
Like, what the fuck?
What I was saying,
You
no,
were
I
the
didn't say
one
you were
saying
like
that bullshit.
transsexuals.
The
I
fuck?
never said that. I
You
never
want to
said
be
you were
a
just like
You
fucking
me.
victim or
definitely
But what
did.
I
something?
said
You
was,
definitely
what I
did.
if
said
Tied
a
to
was,
these
male,
plates,
is
wearing
if
we
a
wigs
all men
male
and
ourselves
certain
in
What
so many
clothes
is? What
different
are
and
we
ways.
wearing
talking
makeup and
about?
exercising
It's like a
to be the
fucking
same as being a
circus.
transsexual. You most definitely did that.
No,
And a whole
I
host of
was
other
saying in
stupid
your
ass
daily
things.
life, even without being transgender, what I was saying in your daily life, all many of
We
us, not
both
all
are
of us,
See,
speaking
you
many
fine
want
of
to just
English,
us
keep
so I
talking
don't even know
about
why you feel like you
participate
got to
yourself.
in
repeat
You
augmenting
want
yourself.
to keep
ourselves
We
in a
were
explaining
here
certain
when you
way
yourself.
said
It's
it,
like
to
so it's
create a
not.
certain
There's no need
persona.
for you to repeat it again.
You're
nobody
right.
At the
gives a
end of the
fuck.
day, what I said was you were making some false ass equivalences for no reason. That's what I said. That's it. I
It's
didn't
no
ask
more
for
false or
you to
relevant than
break
a
the shit
pirate
down.
orb or the kid. Like what the fuck?
That
And only thing
that's
I said,
way more closely related.
no,
That
it's
is way
not.
more closely
No, it's
related
not.
to you
No,
and
it's
your
not.
weird lifestyle than it is for you trying to
Yes,
No,
it
it's
equate the things
not.
that
is.
you've done to your body purposefully
Yes,
to
it
cry for
is.
attention than to say because somebody wears some fucking apple bottom jeans that it's the same fucking thing.
Okay.
Choosing to be a
Yeah,
pirate
Only
is
this
way
thing,
apple
the
more
bottom
only
on
thing
jeans
I'm
are
par
saying
to
boots
your
with the
is that
fur.
lifestyle than
everybody,
somebody
regardless
wanting
of
to
who
wear
you
boots with
are,
fur and shit.
The whole crew was
regardless of
looking
who
at
you
her.
are, you
Listen,
are
Cause that
putting a
song
persona
play.
or an
Snoop
I
image.
ain't
Dogg
gonna
did it.
hold you.
Oh,
That
That's
goddamn
it.
song
We
play.
all
You
have an
might even
image.
like for real.
I'm not like for real. Like, let's not do that. That's why I was saying earlier, you being intellectually dishonest. You're being dishonest in so many ways, but definitely intellectually. And I don't play them games. So you can
I'm
hide
just
behind
really
people
all I
talking about
had.
your
Number
kids or
one,
whatever for a nice little
was your
cop out.
breast
But at the same time, you started all this shit with the dumbassness about people exercising to be akin to being transsexual.
But
Yeah,
okay,
that's
some
number
nuts.
one,
people do.
he's trying to
No, that's what I'm
compare
saying
who has
is
the
what he
baby?
that's
has
not
to
what
I
I
don't
was
even know what the
saying.
normal
What
argument
Who
I
people's
has
was
the
is.
saying,
oh,
baby?
oh
lifestyle.
that's a
my
So
good
That
God.
is what
question,
you
listen,
were
Rio.
saying. You can't even be honest about it
I don't
What
now.
know
I'm
who
That
has
is
the
No,
baby.
exactly what you were
listen.
saying.
no,
yeah, I want to know
what
that
I was
too.
saying, what I was saying was that
Did you have the
people,
baby?
regardless
Number
of
We
one, did
what
don't
you have the
community you
baby?
fit
care.
in,
You just keep
we
Number
all
one, did
do
you
Yeah,
have the
things
right?
to
She
baby?
fit
has to
in
have
like
the
to that
baby. She has a
community.
vagina, right?
I want him to say it though. number one, did you have the baby or did the
I
dude
mean
have the
him.
baby?
Sorry.
I had the baby.
So do you
Oh
think
my
it's so you
god.
consider yourself a male that gives birth?
Are you the father or the
I
mom?
consider
Yeah, cause you.
I'm a dad. I consider myself a trans man. That's what
You
I
know
consider myself to
what?
be, a trans man.
So you
Men,
Okay,
so
so
you
so
you're
so
teaching
you're
your
no, no, no,
child
no.
that
so
the
your
Let's
father
nipples
gave
was
we're
birth?
trying to
lactated
be.
and you was in the bed with your
I
stomach
rather
out and you
no,
think
no.
you're a male.
I rather learn.
No,
No,
I
look.
can't lactate or anything like that. Only thing I can actually do is just hold
So
the baby.
she can
That's
only,
all I can
cause
do.
she can
So
only.
You
I got
couldn't
Hold
another
on,
lactate
Yeah,
hold
question to
because
on. No, no,
ask
no,
you took
because
because
no,
No,
shots
no,
and
no,
you
stuff,
no,
so you
no.
you
can't
can't
having a
have a
lactate. You take all
baby.
that
baby,
stuff to block
why
yourself.
You
would
can't
you
have a
no.
have
baby
hormones
No.
in
No,
your
no,
Wait,
no.
Okay.
body
So
still?
now y'all
So,
know
I'm
the answers.
confused.
Okay,
because
okay.
I can't have a
Point of
baby.
information. Point of information. Okay. I
I
think I'm
don't want to have a
Ariel
baby neither. I don't know what the hell.
Yeah, no man, no
So
Because
what?
if
I
man
mean,
wants
so
to
you
what's
have a
going
can't
on?
baby for the
Is
fact that
lactate, but
you
she
wanted
can
to do it
lactate, but
as
she
well.
can't
are
lactate
you
because you didn't.
were you born female or male or assigned male or female at birth?
Born
However.
female
I was
turned
born.
male.
I was assigned female at birth,
It
Oh,
was a
but I
female
okay.
I,
He
first,
So
said
I
and then
Why are
can't.
assigned
we
it became
female.
a
asking these
Like
male.
But
they
I
questions like
they
we
can't
just
don't know how
supposed
it
lactate.
to
works
know
to
like
have a
you didn't
fucking
have no
child?
gender.
Are
They
we
just
But
serious
supposed to
I
right now?
decide.
cannot. I
I'm just
cannot
like getting
lactate
so annoyed with this
because 20 years
conversation
ago I
because
had a
he's
Oh my
taking us
mastectomy.
God,
on
I'm
a
getting so
fucking roller
annoyed.
coaster
It's not
ride.
about me. Oh my God, it should be about me.
And how I eat my
Hold on,
boyfriend's
did you
butt.
just say you got a vasectomy?
Like,
No, all the time, all like totally tall. Oh my God.
Did you
The
say you got
monkey in the
a
goddamn nose.
He said, it's not
a
about
vasectomy?
okay.
Did
me.
you
I
say you
want it
got
to
that
be
number
about
one?
me.
Like,
no, I had a mastectomy. That's a top surgery. It's with an M, and that's when you
What's
remove
a
your
must?
breast tissue.
Oh.
oh, that's what a
So you
It's when
can't
you
like
get
mastectomy
your
if
is.
you
What
kidneys
they
were
call
chopped
it.
off.
yeah, even if you were like, say for instance, you were a cancer patient or
Hmm.
you were somebody prone to possibly have it as a female, that's the procedure that women undergo, and then they get
Mastectomy.
silicone
Oh, okay.
breasts and things like that. But I didn't do that.
Okay.
I got the mastectomy and then began to just
Just
work
cut
out.
them off with it.
All right. I
No,
learned
him
something.
or his wife didn't get the full surgery. What?
Okay.
I have a question, but I think it's a
They
little
cut
too
them off with a
personal.
cheese slicer.
Well,
Yeah,
I
they cut
mean,
their
My
dick
God.
off with a
all right.
with a
So
cheese grater.
Trolla,
That's crazy.
Trolla, Trolla.
Yeah.
Not a cheese
So
grater.
unfortunately, like I didn't know like the homegirl was a homeboy. So the homegirl that's a homeboy has a person that was a homeboy that's a homegirl. That was a question I
What?
wanted for them. Yeah, I know it's
Yeah, they
confusing
in
as
a
fuck, right?
heterosexual
That's so
relationship. They did
confusing.
this shit for nothing, man. For shits and giggles.
That's why I was like, that's what I
It's
said.
hard to keep
Rock
up
with
with.
me because I had something for you, baby.
Yeah,
Because
this
I'm
nigga.
like,
He's
So
been
listen,
asking.
this
Wait,
a
so wait, it's a
woman. This is
man
a
or a
woman that
female?
became a man. This is a woman that became a man who married a man who became a woman. Yes, so
Yep.
let's
What
get
A
the
over that
fuck?
beautiful
because
and
they
trans
the
keep
woman at
taking it
question,
that.
all
over.
right, so
Yep.
hold on.
I'm
The
not,
question
I'm
I
just,
had,
I'm
the
just
question,
explaining it because I'm tired of hearing
right.
everybody keep coming in and
I
asking the
mean,
same
well,
question.
All
I'm
right, so
glad that y'all finally met
the
somebody
question for me really
that
was,
this is their
hold on.
situation.
The
I've been
question for
telling
me,
y'all that these things
No,
exist.
but
we
hold
met
I've
on.
been
The
somebody
telling
question I
y'all
before
that.
that
really
had the
had
same
was,
situation.
but listen,
Not the,
here's the funny thing. I don't know what
what's the name?
hormones she taking. I don't know what hormones she taking because I love being a taco. I ain't gonna hold you. I love me some meat and potatoes. So for your mate, I'm trying to figure out what because when he is taking those hormones, I mean I don't know when your mate, trying to be respectful, is taking them hormones of estrogen. Did you ever get to a point where like, bitch, you being too fucking emotional? I'm just saying. I'm just asking. I ain't trying to be
Um,
rude.
My wife, my wife has been transgender just as long as me. So the thing is, um, over the
Can I
like,
get a
my
mute
wife
Arcanic?
has those emotional moments. She is like that sometimes, but it's no more or less than. I mean, I think a genetic woman is like she has those moments, but overall she's well balanced like everybody else. She has like the I need to eat a tub of ice cream type moment. She has that. You know what I
The
mean?
reason why the reason
But
why
not
I asked the
in
reason
a
why I
crazy
asked
way.
So
because
who is it?
okay, so the reason
Who is it?
hold on, give me 1 second. The reason why I asked is because again, like I said, I was a carpet muncher and I had motherfuckers carpet my munchies. You know what I'm saying? Type shit.
Oh my
So
Right,
God,
I
right.
was
Kiana.
just shut your
SWV
face,
looking ass nigga.
Trolla. Allow me. What you
Shut the
mean
hell
hold
up,
on? Shut
Trolla.
your face. So my whole point was I'm hearing a lot of you know one of my baby daddies would say shims. Um, I, I don't know the pronouns. I'm old school, so don't get mad at me. So
I'm not mad.
I'm hearing a lot of y'all say like, boom, I want to be a
Oh my
chick,
God, it
but
takes you hella long to get to the point, man. I
fucking
got ADD. Get to it. Let's get it
Yeah,
on with.
please just spit
stop
it
over
out.
talking me. It's him. It's him.
This shit
So
taking
it's
20
him.
minutes.
Stop over. God damn it! Stop over talking me. So what I'm hearing is when you guys go when that person goes to their moment, So it would distract me in my phone calls.
Okay, can
So it
Oh my
has
God,
a
spit it out.
goddamn phone calls and everybody stop distracting me. So my point is, Taylor, let me focus. So what I'm trying to understand is you're telling me that she never went through anything
She got,
where
you got to be a
father
swallower. It
violence
take
him.
her too long to spit it out.
Thank
I don't,
you.
I don't even know what she's saying. I'm lost.
Shit. But now I just wanted to speak on what the young lady at number one had said. She said, don't talk about her kids, but if I remember correctly, she brought her kid to the panel. I mean, you shared your own kid. You can't really then say
Ah,
you don't want the people to
ah,
talk about it. I'm just saying.
yeah.
I
The hell is wrong with y'all?
I'm 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 just saying. But yeah, I get it though. My brother transitioned all the way into a female. He doesn't have his man parts no more. He's full female, and I feel like people who do that should be ready for criticism, good or bad, because you got some of those people trying to come in schools, trying to read books to kids about sexuality, about how to become a trans and all that shit. I don't believe that's cool at all. I believe that that's like a fucked up thing for to allow someone to come into the students and teach them about their body at a young age. So, I mean, do what you want to do, but keep that shit in your own household. You can't come on the panel and ask people about the shit and then get mad that we talking about it. I mean, it's just that's what I'm saying. But I'm going down though.
I do think that
I'm gonna let you know
another problem that we're having
if my brother
is the
did that shit,
language
I would
around it,
disown him.
because can't
If
nobody
my brother did
transition
that
into
shit,
a
I would
female.
disown him.
You can't
okay,
transition into a
Thanks
female.
for another irrelevant opinion that nobody was
Yeah.
asking
I
for.
have
I
two
have a
questions that I was trying
question.
to ask.
Go
So,
ahead, Kiana.
this is for box one. Thank you. Hey, Uppy. So you and your wife, when you got pregnant, y'all, and this might be too personal, you don't have to answer, but y'all had heterosexual sex, and then even with both of you taking hormones, oh sorry, with both of you taking hormones, did that not affect the child?
No, my child. Well, my first
Mm.
son is adopted. I was married before. My first son is adopted. Now he's 20. And my 10-year-old son now perfectly
And
healthy.
the question wasn't to
Like,
be
and yes,
offensive. I really
we
just
did have
wanted
No,
to.
heterosexual. So I'm
what
not
is
offended.
perfectly healthy though to
I
you
only
though?
get I only get
You
offended
straight?
when people like maybe Taylor is like, "Oh, your son's gay," and this that. I don't expect anybody to come at a child like that. Like, you know what I mean?
But
So if
nobody
I
did
had an
come at the child
inkling,
like that.
Nobody
no,
said
Taylor
that.
What
Is
was
your
did.
said
son
was,
gay
No,
though?
no, 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 no.
I
But
But
don't
that's
the
a
even
real
like
conversation
Taylor,
about
but I'm
consequence
not
with
about
no, it
to
doesn't
do
same
that
sex
to
matter.
her work.
relationships
That's
and
not what she
kids.
said.
But
That's not what she said. We're not about to do that. That
Hey, hold on.
I hate
what
Taylor. I
what
wanted
did
to say
despise
Taylor
that
something
say?
bitch.
right quick.
But at the
She
same
said you're
time, we're not
weird.
about to
I
do
wanted
that
to
to
say
her
something
work.
right quick.
But
She said you're
anything that you
abnormal,
would
your
say
wife
about
is
it, some
abnormal, and your child is abnormal, which
That's what she
okay.
is
said.
So
not allowed.
abnormal.
But you but
So
you did
my
show your
child,
child, and this is why we don't want to talk about children. But when you showed your child, you said, "This is my son," and I said, "Damn,
yeah,
that looked like a little girl," and she was like 12 years old. He was like 12 years old, so that's why
he's
I was
10.
confused. It really didn't, I wasn't trying to talk about the kid. I thought you were trying to transgender your kid too, though. I was
But
about
that's
to
not
say
even
your
No,
whole
funny.
house was
That's
wrong.
not funny.
like that's
I just
that's
want to
not
say
how that
something real
works.
quick.
That's not
I
how
just
that
want to say
works.
something
My
real
son
quick.
actually
I
has
just
a little teeny.
Nigga,
He actually has a
if you wasn't
Valentine.
here, you couldn't say nothing. This is actually happening. What the fuck you
I'm
talking about?
just
Funny. We're
Like
talking
I'm
about
hey
not.
actual
look.
life.
Listen,
Y'all keep talking
I'm
about
not
me
saying.
thinking
I'm
like
not
everybody
saying
in this
Niggas
room
just
is
somewhere.
always want
whispering
to
or
tap and
something
say
or
some shit,
typing in
man.
Morse
Everybody
code.
always
I'm
want to
not
be
Nobody
saying
on.
wants me
somebody's not
dissing
doing
nothing.
something somewhere. But only thing I can tell you about is what I got going on. And I got
Got
a
Hey,
you.
son
look.
that's engaged, graduating college, and I have a son right now. We're actually trying to figure out what his Valentine's gift is going to be to his Valentine. Our
Can
All
kids
you
right,
are
answer
cool.
they
can
live
you answer
normal,
box
regular
A
lives.
question? Can you answer box nine's question
I wanted to say something real
about how
quick though.
y'all
I want to say something
procreated?
real quick.
Did he
Yeah,
Just
bring
because I
like
your
wanted
I don't
everybody
really
else
care about that.
like
Look,
procreates.
did y'all
so y'all
so
I
so
you
just,
how
I
had
just look.
heterosexual
So he
sex, like
stuck his
you
dick in
stuck
your
your thumb
That's
vagina?
up
what
into
That's
your
going
vagina.
too far. Don't do that.
we
That's
always
too
have
far.
Was he
heterosexual sex.
breaking
That's
up or is
not
it
going
just
too
me?
far.
I don't
Goddamn,
I
we're
don't
grown as
know
adults.
I
Okay,
don't know.
that's
Hey,
all I
I
look,
wanted to
don't
know.
know
I was just
what
curious.
heterosexual
Hold on.
sex means to y'all,
Hold
look.
on,
I
but
wanted
y'all.
to say
I've
something real
always
quick.
had
Is it my phone
heterosexual
or
sex
Shay?
with my wife.
Might be my
We don't
Okay,
even
phone.
have
that
to go
answers the
all in the
question.
body parts
That
of
definitely
All
exactly
right,
what
answers
look,
the
we
look,
question,
did.
look,
y'all.
look,
Though
look.
that
Yeah,
does
yeah.
Yes,
answer the
That answers
question.
the
because
I
they're
mean,
question.
male
in
and
order in
female.
I
order
just,
So
to
this
get
is not is
pregnant,
Oh my god. One at a time, y'all. One at a time. Shit.
That answered the. Go
this is
ahead,
bro.
not
I
as
OP.
wanted to
Go ahead,
confusing
say
as
OP.
people are
that
trying to make it. They're
look,
still a male and
look,
female
look. Hold on,
couple,
hold on,
no
hold
matter
on,
what
bro.
they
I
trying
just
to
want to
play
say like
like.
I think like people are
It's
getting
confusing because they're
gender.
Who talking,
heterosexual,
Hold
but
bro?
on.
they went and changed themselves up to make themselves look
Look,
like
look,
something else,
look, bro.
just
Look,
only to
bro.
have a heterosexual relationship.
Hold
That's
on,
confusing
hold
to me,
on.
but
Look,
I don't know about
look. I
y'all.
just think that
No,
people are
you hold
getting
Box
on.
gender.
Damn.
six. My question was two
All
Yeah,
right,
you
parts.
cool.
the
So
one that
look.
need to
Wait,
hold on, bro. You
he
just
didn't
came in
even
this
finish
bitch trying to force your
answering
still.
the question.
Goddamn, put some fucking Vaseline on your conversation. You forcing shit
All
in,
right,
bro. This
cool. So
conversation
I just
rape.
want to say that
The
like
fuck is wrong with you,
yeah, I
bro?
think
who is
it's a
Get rid of
difference.
this nigga.
Like
Vaseline?
My
it's a
God.
Yeah,
look.
Yeah, this
partner.
It's a
Stop
nigga,
being
difference.
you're not
wildin'.
fitting in, bro.
No
Facts.
You're not
lubricant.
fitting
Right.
in,
He
man. You
got
don't fit
no
He
in.
was doing
lubricant
the
at
most in the
all.
comments too.
All right. So look, I think it's a difference between gender psychology, which is like basically conditioning like men wear blue and girls wear pink. That's psychology. But gender
What the
biology is
fuck?
like the gender that you was
That's
born with type shit.
sociology, but go
And
ahead.
I think
Yeah,
that
that's
people
not
are getting those
psychology,
two confused.
motherfucker. Stop trying to sound
People are
What
getting
intelligent
those
saying dumb
confused. No,
shit.
no, it is psychology because you don't even know what
This
psychology
nigga
sociology.
is.
retarded, bro.
Sociology, you fucking
Oh my
But
idiot.
no,
god,
Because it
man.
has to
all
The
do
right,
hell
with
what
with
is
sex.
social?
This
All
sociology?
right,
nigga's
then
a
what is
nitwit, bro.
sociology mean?
This nigga, hey,
It
bro,
has to
you
do with
dumb.
All
You
right, then
dumb
what
as
is
biology.
hell, boy.
Just let him
then
finish.
what is
Let him
sociology
finish
mean?
his statement so he can
What does
All right,
talk.
so what is
sociology
social?
mean? This shit
Yeah,
crazy.
what does it mean? Tell me, because I don't think you know what it means,
Come
bro.
on,
No,
just say
you
what
don't
you
know
gotta
what it mean.
say. Y'all about to go into a whole different
Nah,
questioning.
because
Just
I know what it
finish.
means. Sociology is the study of how people
In
socialize. So
society,
no, that's
in
not
Okay,
socialize. That's
so
it,
that's
how
not
is
In
socializing.
you
society.
saying
so it would be
gender
Nah,
roles
it's
society.
the
and
study of
Okay,
how
can
sociology
I
people
is
have a
not
question and
socialize.
then y'all
psychology,
can
you
drop back onto
nitwit.
the comment?
You just answered your
That
own
boy
question, you
slow.
dumb
All right,
fuck.
hold on. Watch this. Watch this.
This nigga is
Oh
retarded,
my
bro. Do you
It
know
God.
they
also
have
goes
social
into the
psychology as
patterns of
well?
social relationships. So all of that good
Exactly.
stuff.
So I just have a
They
quick
they
question.
actually have a class in college called social psychology as well. But
Yeah, I'm
that
on
that
the
shit,
third part now, Chola.
yeah, it
Yeah.
depends
Oh
on
my
it talks about
god.
the
Oh my
psychology
god.
of
Oh my god.
society itself. And it's talk about mindset. So when you talk about psychology, you're studying how people react to stimuli.
This
You're
nigga
not
is
you're not
stupid.
talking about gender roles and gender specific. You're not talking about gender roles,
Bro,
which
you
you're
should
talking
never
about,
try to come
which
for
is
me, bro.
totally
You should
different.
have never tried to come for me.
Okay, you're
Sociology is the
gay because
study of
I never
social
heard of a
life,
heterosexual man
social
saying come for
change,
me.
and the
It's just
social
you're using
causes and
words that
consequences
I don't
of human
associate with.
behavior.
Yeah, I don't
Sociology is
speak
the study of
homosexual though, so
social
I don't
life,
know what you're talking about
social
anymore.
change,
Hello.
and social causes. Yeah. Don't try that again. Don't try that
That's
again.
how you
My
get child
intellectual
Bro,
preferences that
you
you're
inferior.
are
referring
wrong, you
to.
dumb
You
My
fuck.
know
What are you
you can't
talking
intellectual
prove
about?
inferior.
anything with that
My
definition.
You
We
know you
intellectual
know
are
that it's
inferior.
wrong,
in
you
relation
stupid.
to how
You,
humans move
hey,
You
with
hey.
did
each
Dumb.
other
This
technically
I
nigga
went to
in
still
Wake
saying
Up.
it's
society,
right,
disrespectful
which
even
is
though he
what was
got
now.
said.
corrected. This is dumb. This nigga dumb as
Like,
hell.
what are you doing? Like, you're proving him right.
Yeah, you
How
keep
am I
You're
proving me
proving
proving
him
him
right,
right
right?
with
saying
this
don't,
definition.
and then at the end say, "Don't try to come for me,
I just
girl."
said.
Shut your dumb ass up, man.
How
Go
am I
ahead, say what
proving
you
you
was about
right?
to
And
We
say,
what
said
you
boy.
two
were meaning
different things.
about boys
We
liking
we, we
blue and
said
girls
two
Let's
No,
different
liking
things.
pink,
go.
that
Because
will
I've
be
been
a
We
waiting
literally
we
child
this
said
did.
two
And
long.
you were
different
telling
things,
him
bro.
about the
Dumb.
definition that he gave, which his definition
No,
for
that's
that word
not the
was
right.
definition
correct.
he gave. That's not the
The
definition
fueling
he
of
gave.
stereotypes and
He said that the
sociology
God,
definition of
that's
that's
the
been
the
studied.
study.
definition of
No,
sociology.
no,
Nice
no.
try,
What he
though.
said is
Yeah, just get what you're saying because it is sociology. Like I said, what you were referencing to with the girls liking pink and the boys liking blue, the child preferences that are fueled by stereotypes. Sociologists do study that, sir. So just go ahead and
nah.
ask your
I'm just
question,
saying we said
statement, or
two
say what
different
you're saying.
Right.
things. he
Play
tried
with
to say
something
it's the
safe
So
study.
because
don't
you
come for
failed
me,
that.
All right,
girl. So
look,
don't come for
nah,
me,
nah. He
girl. I
tried.
didn't send for you.
Look, look, bro. You tried to say it's the study of society, and I told you no, it's not. It's the study of how people
This
socialize.
nigga's an idiot,
So,
bro.
like
It
I
is a
said,
part
we
This
of
take.
nigga's about
societal
as dumb as a
aspect.
box
That's
of
the
rocks.
same
And
Where do
he's
you
thing.
think it
rude as
gets
shit.
No, it's
societal
Not
not.
even
All
norms?
right. Well,
against
listen.
any of the other
If it's the
How do
parties,
you
same
but
think
thing,
it
he's
hold on,
gets
like
hold on, hold
permeated
on.
from
he
Come on.
sociology?
wants to
Well,
come
if it's
No,
the
in
you're
and
same
not supposed to
thing,
be
add his
rude to
well,
my.
fucking
You're not.
question.
Nobody
hold on,
gonna
hold on.
be rude to
Well, if it's
Kiana but
hold
me.
on, hold on. If it's the same thing to
He
how
said,
you
but
calling me
me.
an idiot,
Shirley,
right?
shut up.
It's
If it's the
crazy
same thing to how
how
you're gonna call me an
his
idiot,
lack
bro.
of
You're
comprehension
an
was
idiot.
Exactly, bro. You just
You're
trolling,
an
amazingly
bro.
idiot,
visible
bro.
in
Exactly.
You
the
have
You just
comments.
horrible
He
trolling, bro.
came
comprehension
up
skills.
here to
What?
verbalize that.
Gender toys affect children and their perception of society. It's a societal study. It's been out since like the fucking 50s. Like,
That's
just go read
incorrect.
it. Shit. What
That's
were you trying to
incorrect.
say,
Actually, read a
sir?
The
book
study is
first. How
supposed to
about
No,
that?
learn
it's
Try
not.
that.
social
How the
changes,
fuck are you
social
telling me that's
Try
causes.
reading.
incorrect?
It's
Incorrect.
Oh my
fundamental.
god.
Incorrect. I think you need to try reading because you said it was the study of society. That's not correct,
Oh
bro.
my
The study
God,
of
this
social
nigga still
life.
arguing. No, you niggas done proved this shit to this idiot 1,000 times. He's still trying to argue about nothing, bro. You're dumb.
Yeah, but you
All
tried
right.
you
Can't be
tried to
helped.
say it was something else
You
though.
can't be
You
helped,
tried to say
bro.
it was the study of
You're
So
not dumb
Betty
society.
because you
trying to
made a
say
false
Okay,
something
statement.
okay.
You're dumb
Kiana
because
incorrect.
asked
even
a
when we're
second
trying to
Can
question,
correct
so
you, you
I
Kenny
can
stupid
answer that
go?
won't
question for
listen.
you. Like, can
Because
Kiana
you tried to
ask?
say it was the
Can
Yeah,
study
yeah.
of
Kiana
So let
ask
society.
her
It's
Tiana.
second
not the
Go
study of
question
ahead, Tiana.
society.
so
Ask
I
the
can
other
ask
part of
my
your
question,
question. We're done
please?
with this idiot.
It's not the
Thank you,
study of
Troll.
Yeah,
society,
Thank
bro.
because
you.
your
Okay.
time is up. Your time is
So
up.
I don't know,
Stop
Box
cutting Tiana
One, if
off. I'm gonna
you
do it.
heard me
Low ass
the
reading
last
level.
You
time,
tried to say it was the
but
study
I
of
did have two
society.
parts.
You're fucking
Okay,
Shut
retarded.
Box
up,
Six,
boy.
we
Oh my
don't give
god,
a
it don't
motherfuck.
matter. It does not matter.
God damn.
Oh, but it mattered when you was trying
I
to
was gonna say
diss me.
nobody
Listen.
cares about your
But
point.
it mattered when you was trying to diss me for it. All right.
Okay, go cry.
And we're
Go
gonna keep
cry about
dissing if you
it.
don't
God,
shut
Oh
the
my
you're
fuck
God,
up.
so
it
You're doing
matters
too
when
much.
you
annoying.
try to diss me. I'm hurt. My
It's
feelings
just
are
Okay,
hurt.
okay, Kiana. Go ahead,
emotion
ask your question.
taking them over.
I
Oh,
just wanted
sorry.
to
Go ahead.
know how it works with two people who are taking hormones that altered them, how that works with a fetus and the growth of the child. Now, he did say that the child was fine, that's fine, but I still wonder because I know, I have children as well. We're not, shit, you can't even eat fish. So, how does
That's
that
right.
work with,
Who thinks
taking
Kiana's taking
hormones
my
and
stupid
being pregnant?
questions?
Actually,
And
for
did you go full term?
And I'm
Hold on,
not
hold
trying
on.
to be
Let her
Sorry.
let
aggressive.
let
I'm
him
still
answer that
aggressive
question, and I'm
towards
gonna let you
Boxy.
go, Opie. Go ahead.
yes, I did go full term, and then
Oh my God.
with that, when you begin the process, and I became pregnant, um, you stop taking everything. Any medication that you're taking, any kind of, you stop taking everything because you can't even eat lunch meat when you're pregnant or eat hot
Right.
dogs. You know what I mean? So the same rules that apply to
Mm-hmm,
you
mm-hmm.
apply to me. So I had to stop taking all forms of medication. No Tylenols, no testosterone, no nothing. No cough syrup, no nothing. That was the cleanest that I think I've ever lived.
You can take
You know
Tylenol.
what I mean? No, I didn't take
Not in my
anything.
case, sis.
Like, you know what I mean? Because you're not even allowed to really eat lunch meat or hot dogs. And like, there's a
How
lot of
long
stuff when you're
before
pregnant
you? How
that you
long
can't
did you
do.
have to do that before you
Should eat
started
this.
trying to have a child though? You had to do that like a year before, or a couple of six
Yeah.
months. Like okay,
Like, like a year, about a year. It was about a year's time. And I had to get myself, well, for me personally, it was always, I wanted to have like a good, beyond any of this that we're talking about, you know what I mean? It's also very important to focus on Black mortality rate as far as women and birthing children.
Mm-hmm,
It's
mm-hmm,
very,
mm-hmm.
very, the numbers are horrifying. So because I saw those numbers, I actually found a Black fertility doctor to, assist me. I had my mom was a doula. She's also a doctor. Um, and
I'm
I
out from
just
Hoover
ate
too.
I just ate very clean because it's more than me being trans and pregnant. That's actually very rare. If we ever talk about pregnancy again on this panel, I would really love to come and talk about the mortality rate of Black women and their children and giving birth and their accessibility to it
We
because
definitely talk about that.
disparities in the
It's a
Black
real
community for Black
conversation.
women to
I don't
birth
believe
healthy
that's a real
babies.
thing.
No,
It
it
is.
is.
It is.
It
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 is.
is
ain't.
trolling.
But if you
Yeah,
And
don't
it's
the
identify
definitely a
as
real
a
thing.
woman anymore, why do you think you deserve space in that conversation?
no, I was just a carrier and I was a Black person that carried a child. Like, you know what I'm saying? And I know if I didn't have the funds that I had to pay for a lot of this care, that it would have been really deplorable. So what's available to, an everyday regular degular person is definitely not satisfactory. That's why I would speak on it, because money shouldn't buy you good health care when it comes to, birthing children. You should be given that as, like a humanity thing. I don't,
Okay, that was
that's
you
riveting,
why.
but that
mentioned
doesn't answer
you
the
mentioned
So,
question. The
carrier
so
question
though.
you
was
saying
if
doctors
you
shouldn't
no
get paid?
longer identify as a woman, let alone a black woman. Why do you feel like you deserve a seat at that table about black women's issues, or
I don't
in
have to be at
deserve to be in that
I don't
space?
have to be at the table. I don't even I mean, I would just like to hear the conversation, to hear actual ideas that maybe as black men and women, you know what I mean, we could come up with to make a better outcome for these black women that are having these children, that are creating this huge disparity, health disparity gap. I mean, I don't think that it's just the responsibility of the black woman to solve that problem. I think it's a black community thing, and everybody should be concerned if black women are not able to have safe pregnancies. That should concern the man, the woman, and everybody, like everybody involved. So I don't have to be at the table, but I definitely would like to be a part of the discussion, to hear and collect some good information on it, so that we can really come up with a solution, because that's a real thing, regardless if people want to believe it or not. You know, and I mean, just my situation is not even applicable to me. Like, you know what I'm saying? It's not, but it still shouldn't be happening to people because they can't afford quality health
Y'all
care.
definitely should check out this documentary. It goes
I
into
can't
more
sit through
detail.
it.
I
Yeah,
do.
it's
You
on
think
Hulu.
It
I
you
goes
can't.
into
I
more
think
can't sit
because
details
through it.
black
about
women
what
lead in
speaking about.
obesity in America, that a lot of it has to do with the fact that they don't have the healthiest lifestyle when it
Yeah, it
comes
has everything
prior
to do with
to.
blood pressure, though, Ro. I
Wow.
was just about to say that. That's why it's
Nutrition.
not really a fact. It's not based on the
What?
fact that they're black. It's based on the
That
fact
is
that their
not.
diet is fucked up. Black
Yeah.
women and black men are more prone to high blood pressure. High blood pressure during pregnancy is a health risk at all times. So you're literally high risk if you have high blood pressure. Black women, a lot of black women are 40 or 50 over, like they're like at 50 before they get pregnant, and then they get pregnant and their blood pressure goes up because of the pregnancy, which puts them at high risk. It's just a
I
fact.
I mean,
also want to
I definitely
say
think
that
that's
I was
something.
not overweight when
That's not
I
because they're black
became
though.
pregnant. I was, and I just want to go to
What?
your point, Chola. I was not overweight when I became pregnant, but of course you gain weight. I now have high blood pressure issues now after having the child. So I don't know. I just wanted to say that, but
Yeah,
yeah.
So here's the thing, right? And
Son about
and I'm not saying that the blood pressure and the obesity and things don't play a factor. The issue is the lack of attention that black women get in some of these
Or about the
hospitals,
fact they still think that we don't need as much medicine as white women, which has
and
been
that too.
systemically been
It's
going
it's
on for
more it's
fucking
more
ever.
prone to the care
Medical
and the
apartheid,
neglect
anyone?
that
The
comes
hell?
from the people, from the nurses and the doctors and everybody else who works in the hospital. That's more of the conversation than the health thing. Because a well healthy woman shouldn't be hemorrhaging, or you forgot that she was hemorrhaging or whatever. Like, these issues are a real problem, and black women die at a much higher rate than any other race when it comes down to birth, to giving birth. So that's a problem, and a lot of times it's the lack of care from the physicians and the nurses in the hospital.
Right.
I'm sorry,
This
this
is
is
but
an
the
this is more than
The
actual
just a
problem with
health
thing.
having a
thing.
problem is the problem with having a problem is you have to find a solution eventually. But when you're looking at
Right.
the wrong shit to find a solution, then you're never going to be able to fix the problem. Like at the end of the day, if you actually go into detail about the mortality rate, you'll see that it's because of blood pressure. Like black men are more prone to high blood pressure. Like my bullet moves, my blood pressure goes up. If anything goes up, with it just happens. It's a fact. It's natural. So we definitely have to change our diet. Like I had to change my dietary program as I get older because it's easier for me to get high blood pressure. That's just a fact that I have to face as a black man. A fact that you have to face as a black woman is you cannot eat whatever the fuck you want, pizza and all of this other shit, and then get pregnant and think that you're not going to have a high mortality rate. It's just a fact. Like
Well,
blacks and Hispanic women have high mortality rate, and it's really dietary based. Because you would never see like a woman, and it don't have nothing to do with fat or none of that shit. It has everything to do with blood pressure. It has everything to do with hypertension. So you can be skinny and still have high blood pressure. That doesn't, I don't know. You don't have to equate weight to high blood
Yeah,
pressure. You can be
you can
fat
just have a
and have good
bad
blood
diet.
pressure.
Yeah,
You can be skinny and have high blood pressure. That shit has zero to do with your weight. That's everything to do with just your diet and on your day to day living, how you, your stress levels, all that shit has everything to do with your blood pressure. On top of that, you have
I'm not
sodium.
saying
Like
that you're
people kick in
wrong,
a lot of fucking sodium. You niggas be eating noodles, top ramen noodles, half of your life, and then go get pregnant and be like, damn, I don't know why if I got a high risk pregnant. The way it could be the noodles.
but what I'm saying
I
to
Well,
you
didn't
who
is that
say
who
that
said
you're
you're
you
right,
needed a
wrong.
thousand
but in the
grams of
same
sodium
light,
per day?
he he's right, and that is a part of it. It's not the sole thing, because I would tell you, being allowed to be in these spaces to give birth, it is really it's also the healthcare disparity. Like, you know what I'm
Mm.
saying? It's what's available to Black women and how they're actually taken care of. What you're saying is also true, but the care that they're actually getting from these doctors is also at not right. Not It's not. And I mean, only reason I know is because, like I said, I paid to have a better experience. And if you don't have the money to pay for it, like I did, you might
A lot of these
be
people
in
don't
more
care.
on a more,
Malpractice happens on any level, man. That's so when white people are more prone to catch cancer, right? So they have malpractice lawsuits in cancer. If you go check it, they're more prone to have a problem with that situation. Also, dementia, they suffer from that as well. There's also malpractice lawsuits on how they handle the first stages of
that's a
dementia.
fact.
So at the end of the day, this happens. That happens to everybody who's prone to something. Black women are only people. Black people are the only people that think that when they go see. This is the part that I don't get right. Black men in the hood get shot all the time and they get saved. I know hella niggas that got shot, including myself. They get saved, but for some strange reason, they want to target black women who are pregnant. This is what you're telling me. I don't think so. And on top of that, I've been in the hospital, like you said, in a situation where a black woman that was giving birth for me, for my daughter, was asking for epidural before they got to the point where she needed it. She just wanted the epidural first. And they was telling her that she didn't do it, she shouldn't do that, and she did it anyway. Guess what? When it was time to give birth, she had a hard time pushing because she couldn't even feel herself. So guess what ended up having to happen? Guess a C-section. A C-section had to happen. You see what I'm saying? So this also goes to decision making when it comes to pain meds as well. Like you can't, when you get pain meds, it's definitely a problem in that situation. If you get a lot of pain meds, and you think that you're going to be able to feel your body when you're pushing, because these doctors, they want to do C-sections because they get more money for it. But the actual doctor themselves, they don't get paid nothing extra. The hospital gets paid more money. So the rumors that people be like, these doctors are doing that on purpose because they want to get paid more. No, they're not. They don't get paid more at all. It's the hospital.
Yes,
The
they
funding for the
do.
hospital gets paid more.
well,
The
I'm gonna be
actual
real with
doctor
you.
themselves don't get paid more. That's a lie. If you want me to put
Accessibility
my sister, if
is
you
a
want me to
big
put my sister
thing.
on, who actually did deliveries before, but she went back to school. She don't do it no more because she's doing brain surgery now. But before, when she was doing deliveries, she told me she didn't get paid more. What the hell?
Right. And if you guys are looking in the
But the
comments,
doctor bills the
Organic is actually
hospital.
posting some very interesting things.
Exactly.
Um, she had posted some very interesting things. And when we do talk about, if you guys
Organic
do
is
talk
light
about this, and
skin.
she tagged me
Fuck
so I could
you.
come in, I could talk. Because from what I witnessed, not only the things that you have mentioned, they're very valid things. But it's also, to me, the disparity and the Black woman's options to choose physicians that she feels that are better for her based off of an insurance plan, especially when you
Mhm.
start getting on like public assistance and things like that. The things that are available to you
What
on
the
public
fuck?
assistance is not, no, seriously.
Man, you
Especially
guys
like
sound like Biden,
I'm in
bro. This shit
Pennsylvania.
crazy, man. White women are
No,
on
but
public assistance more than black women.
no,
Stop this
I'm not
bullshit, man.
saying, listen, I'm not saying that they're not, okay? I'm not saying that. First of all, I don't give a fuck about white women. We're talking about black
But
children and black women
Kay, a lot
mortality
of
rate.
that goes down to a lot of that
I don't
goes down
understand if you
to
don't
not being
comprehend why I said that or
informed.
not, but
A lot
I
of
mean, I
a
understand
lot of
what you're
people are not
saying, and I'm not
informed when it
saying that what
comes
you're
to
saying is
getting pregnant.
invalid.
but they're not
It's just
informed because a lot of times it's based on what the doctor takes. So if some doctors will just take base depending on, it depends on the insurance in which you have. You have an option to choose between the different insurances, and most time people are not aware, and they just go with
hmm
whatever the doctor says. They don't look into what's available when it comes to their insurance.
right.
Exactly. Like,
And
or
you
when
have
my
to
son was born, you got to go look at the doctor's office. You got to do your histories. You can't just. Some people don't do their research. They just go have a baby wherever the fuck is closest to their house. You see what I'm saying? And at the end of the day, there's certain hospitals that are better at certain things than other hospitals. That's a fact. So you got to look up the hospital near you and see and actually start doing visits with that actual doctor beforehand so that you for sure have that doctor on call when you are ready to give birth and you're not just going to some rando. Like this is just
I'm gonna be
like
honest
this
with
is a
you.
normal procedure that adults have to
My
do.
fertility doctors, and I will tell you this, my fertility doctors, they didn't take. I have Blue Cross Blue Shield, the highest premium one that you can get, and
Me
it's
too.
an extension of something called Progeny. It's called Progeny, okay, and it's attached to my Blue Cross Blue Shield. Now
You said Blue
that
Cross Blue
covers.
Shield, the highest you can get.
No,
You
it's
nuts.
Blue Cross Blue Shield. Hold on, it's Blue Cross Blue
Probably in
Shield,
her area, Tola.
but then it's
Okay.
connected. It's connected with something called Progeny. Okay, not all the plans are covered with this, so they cover a lot of your medical needs regardless. So there are hospitals here in Pennsylvania, like the University of Pennsylvania, where I did go through my fertility, and where I'm actually going through my fertility again. Um, that they won't even accept you if you're on public assistance. However, they offer great medical care. So here in Pennsylvania, it's based off of really your income. And that's why I said that that's not right, because I shouldn't be able to have something because I have this, even though this black woman is going through the same thing that everybody else is going through. So in Pennsylvania, I don't know about the state or where you're at, but if you go to the University of Pennsylvania, they're not going to take Section 8 or welfare insurance to have your baby. They're not. They won't even see you beyond the ER. And that's what it is. You have to have either
Are
Cigna.
you saying that they
Um,
won't take Obamacare at the hospital?
No.
You saying that's what you're saying?
no,
PA
no, not for certain
Obamacare
things.
doesn't work in PA like that.
Yeah, that's what I'm saying. It doesn't work. Every state is different. So these women that are in like the state of Pennsylvania, they cannot go to the
Oh, the
fertility place
Obamacare
that
was
I went
underneath the
to with
federal
no. And I'm
mandated
telling you
health
right
care.
now, I can show you my insurance paperwork where they charged it and do. Then you can look them up yourself. They do not accept it unless you're rushed in by like the ER. They'll fix you in the ER and send you on your way. But even when you want to go back and get care, if your welfare insurance doesn't cover any specialists in that hospital, and fertility is considered as a specialist here in Pennsylvania.
Hmm.
So those women that are denied that access, regardless if they have high blood pressure or not, you're already deeming them to secondhand care because you are rated number one. So even with your philosophy of go search what's best around you, they're not eligible to even receive it. You know what I mean? And those are the kind of things that,
You
have to
it
change.
don't matter. That don't make sense, bro. Like that's what I'm saying about like that's a
I'm just
childish way of
telling you what it
thinking.
is,
You
bro.
still
Tola,
it doesn't
Tola,
matter. It
I'm,
look,
you
I'm
it
not
doesn't
no,
lying
matter
to
but
you,
if
bro.
your
but
insurance
she
if your
told no
insurance
lies
only
because
allows you to go to 5 hospitals in your county, right? Well, it
oh
ain't
my
gonna be
god.
5 hospitals now. But let's just say you have 5 hospitals in a certain block radius. Your insurance only allows you to go to three. You search the best of the three. It's really just common sense. Like you guys are making 1,000
No, what you're
excuses
saying.
for
No, I'm
adult
not making
decisions.
excuses. What I'm telling you is what I actually experienced giving birth and about to go through IVF again. If you don't want to
Man,
have that as
look,
valid
I have kids as
information,
well, man. I have kids as well.
then
Your
I'm not
experience is
saying
not
that you
limited to
don't.
just
But
you.
you had
So this is
kids,
what I'm saying.
sir,
So
no.
look.
You
Just
had
because
kids in the stance that
you
you
talk,
donated some sperm.
you
I'm
talked, and I
talking
didn't
about a
cut
9 month
you off. So now that I'm
fertility
talking, you don't
program.
have the right to cut me off because you gave birth. That doesn't give you the right to cut me off.
No,
Stop
but
cutting me
and
off.
you don't have the
I
right to
keep
tell me what
telling you
goes
that
on in
shit.
Pennsylvania when
Bro,
I
look,
know what's
look. This is
going
what I'm gonna
on.
do. I'm gonna just shoot your ass if you keep cutting me off because you're being rude at this point. I listen to you talk,
Jeez,
and I know you're taking hormones and you can't control yourself. But when I'm listening
here
to
we
you
go with the
talk, right,
insults.
and you
Oh
went through the
God.
whole shit. Now it's my
Here we
turn to talk.
go.
You want to cut me off and say I'm the one that had birth. I don't give a fuck about you having
But you're
birth. What I'm
spreading
saying is,
misinformation, and
oh
this is
my
not going to
god,
help us solve the
shut the fuck
problem.
up, bro. At the end of the day,
Oh,
you
here we
still
go.
can
All
do
right, tell your
research.
misinformation. Go ahead.
I'm about to shoot this nigga. I don't give a fuck about him being an attorney. Like you really don't understand. I don't give a fuck about you being content or nothing. You've been doing good for a little while. You're gonna control yourself like an adult. That's all I'm asking you to. That's it. It's simple. Misinformation, that doesn't make any sense. You don't have information about shit except for Pennsylvania. And I don't even believe what you're saying about Pennsylvania because it's a
Well, then look it
federally
up.
mandated
Even Box
law.
11 said
Okay,
that
so
what I'm
I'm going
saying
to
is
go
right
look
because
it
she's
up.
in
I'm going to
Pennsylvania.
go look it up. But
No,
you see how you can't
I'm in
control
New
your fucking
York,
self?
but I
You
heard
see how you can't
that
control
one.
yourself? Like, goddamn, I'm gonna look it up. So shut the fuck up. At the end of the day, though, the reality of it is you still have to look up the hospitals that's covered by your insurance. You still have to shop hospitals. You still have to shop doctors. That's how the fuck is that misinformation? You're just dumb as shit. Like you're just gonna go to any fucking doctor. You think because you
You
want to just
don't.
put out
But
here
you're
that you
missing
got
what
some
I'm
kind of money.
saying. The best
You still
doctors are
look,
not
look, you're trying
covered
to put
under
it out here
public
that you got
assistance.
money.
That's what I'm
That's
telling
why you
you.
have health care. You don't,
Oh
it
my
don't matter
God.
about you having money. The reason why they gave you better health
It
care is
does.
because
Here
you're a
it
fucking
does.
science experiment. You're a science experiment. So of course the doctors want to experiment with your ass. All the doctors are raising their hand like, hey, let's give birth to the I want to be the one to give birth to a man having a fucking baby so they can take pictures of you because you're a circus monkey. Like at the end of the day, for regular
Oh
fucking
my
women
God,
though, they should make
bro,
sure they have a good
Right,
doctor
right,
and they should
Enigma.
check the doctor's background on giving
bro.
birth. That's just called common sense. But you are a science experiment. That's the
Mm.
difference between you and regular women.
Um, can I jump
Well,
in?
the conversation is sure.
Okay. What I wanted to say was when I was pregnant, I live in Texas, right? When I was pregnant, we get to go through what's called Texas Star when women are pregnant, right? It's just insurance for pregnant women, right? They do give you a list of hospitals, doctors, so and so, XYZ that you can go to. It's a
Exactly.
pretty good list. We had to go actually make appointments to go talk to the doctor, make appointments to even go look at the hospital to see if we even like the hospital room. We had to do that well before the birth to decide where we wanted to go. And we just had to choose the best of the best. Ultimately, he made the decision. It was what he, even though I was giving birth, he decided which hospital he liked based off of the amenities and the care that he thought that I would receive better. But so we like, I feel like that's just for any insurance. So like I don't
Yeah,
get it.
even
Like
if
okay,
I
they
have
don't give.
Kaiser Permanente
Well, what
insurance,
I was
right? So they're
explaining,
gonna give me a
oh
list
my
of
God.
physicians that I can go to with my insurance. If you have Blue Cross Blue Shield, they're gonna give you a list of physicians that you can go to. If you have state insurance, if you get state insurance, which out here is Medi-Cal or Medicare, right? I mean Medi-Cal or Medicare, they're going to give you a list of physicians in your area that you can choose from. All you
Yeah,
have
that's
to
true.
do is
Do
look
know
at the
y'all
list
live in
and you
two states
look
that
up the
have the
people
lowest
on the list and see
moralities,
if they're good at what you're
birth
trying to get
mortality
health
though,
care
right?
for. That's a simple thing. Like I don't
They you
understand
do
how
get it
you guys are
every
adults and
because
don't
you're
know this
missing what
shit.
I'm
Because
Like
y'all
this is
saying.
live
nuts.
in two
Can
Everybody,
I
states.
say
okay,
Because y'all live in two states where y'all have the lowest birth mortality rates. Y'all live in California and Texas. They have the lowest because of y'all insurance and the help that y'all get out there. But not everybody has that exact type assurance. That's why I put the statistics in there about Mississippi. Now them on the other hands, they shit is deplorable out there for their birth rates.
So
But
look, Obamacare is federally mandated. It's not state to state. So some of the stuff that y'all saying is ridiculous because you don't know the difference between state or federal. But at the end of the day, it's still a reality. No matter what insurance you have, no matter what state you have, they're going to give you a list of physicians that you can go to based on your insurance. It doesn't matter if you have good insurance or bad insurance. They're still going to give you a long ass list of people to choose from when you first get the fucking insurance. So if you're having a child, you need to look through those doctors and see which one of them has a good has a bad mortality rate when it comes to giving birth. If that person had two deaths in the last 5 years, you might not want to go to this motherfucker. It's just really common sense. Like, I'm not saying nothing that's hard for you to understand or grasp. There shouldn't even be no argument about you being a fucking adult. Like, I think what y'all want to do is just make it to where, oh, black women are suffering so bad because of this, and come up with all of these goddamn reasons why you don't have to deal your diet right and why you don't have to pick a good physician. But these are important factors when it comes to getting birth. So, like, the information that y'all giving is misinformation. It's not going to help people at all. The information I'm giving is going to help people. If your diet is right while you're pregnant and before you're pregnant, you're more prone to have an easy birth. It's just a simple thing. This is really common sense here. If you pick your physician based on their qualifications, you are going to have a better chance at not having a C-section or dying on that table. Straight across. I'm just saying, like, that's common sense. You can unmute.
Okay. Can I
Nobody, can
just
I
say
say
something?
something?
Go ahead. Go
I'm
ahead,
not
hon.
I'm not arguing what you're saying. They give everyone a list. And I don't know which state you're in, but I'm telling you, here in Pennsylvania, if you do not qualify for certain doctors, that is not going to be on the list. And what it is here in Pennsylvania, it is by your insurance class. And that's all I'm saying. What you're
Um,
saying is accurate. But when you get here to Pennsylvania, if you're on public assistance, they will give you a list of all the doctors that you can see. And you have to
Right.
pick out of that list the best doctors that are available to you. But that doesn't mean that they are the best doctors. They are the best doctors that they
Right.
are giving to you out of a list based off of the insurance that you provided. That's what I'm
Right.
but
saying to you.
the
Everybody
premise
gets a
that you,
list,
this
This
is
is
what you're
everybody
fucking
gets
saying,
a
Rod.
list,
ridiculous that y'all
but
That
the
believe
people
that
list,
on
there's
welfare
a
don't
list
get
of all bad
the
doctors.
specialists, that they can't get a specialist.
You,
But that's not
you'd
true,
be
because
surprised,
in the state
Joel.
of Pennsylvania, if you are on welfare, you can have a baby off of the welfare. Like, you really can.
yes,
You don't
I'm
have to
not
pay
saying that
You
you
shit.
can,
cannot have a baby off
absolutely.
the welfare. But what I am
But
saying to you,
there's something too that you're not looking at, because if that doctor is an out of network, you can actually, it's some paperwork that you would have to go through in order to get the insurance company to pay. But the insurance
I
company
don't
will
think
pay up
PA
to a
has
certain
that,
percentage for
sunshine.
the out of
That's
the.
federal.
I didn't hear
right,
you.
It's oh
it's
my
out
I
of
don't
god,
think
this
network.
Listen
shit
to
is
me.
They're
PA has
only
that.
putting
crazy.
doctors on
Mhm.
your,
This
All
shit
they're
the
is
only putting
crazy
doctors
businesses
on
because
are
that
it's
list,
on
actually
bro,
born
federal.
that
on
have
Let me
no
tell you.
welfare.
coverage. Once you
So
go out
can
of
I just
network, you have to pay
Hey,
a
Otaro,
balance.
don't you live in Philadelphia?
Yes,
No,
I
Do you live in
do.
Pennsylvania?
Yes, I do.
So, so is
Right here on Penn
Philadelphia for
campus.
some reason exempt from federal uh, health providence?
I never said that.
Absolutely
People,
not.
yeah, that's what it's equality in healthcare is part of this country's. I don't, man, I'm lost right now. Like, you
Hmm.
guys are trying to go state to state with this shit, and I don't understand
Guys,
why. This is the part that I'm lost
because
at.
fertility is not
I think
like
y'all.
MD. Fertility is actually a specialist doctor. So when you go to the University of Penn Medicine, like I did, I can give you the name of my OBGYN, okay? That was my fertility doctor, and they will tell you we do not accept Medicaid. Like, you're telling me something that I went through. That's what I'm
Yes,
telling
but
you. Not
fertility doctors don't.
Do you know what
most
But
fertility
Medicaid is?
doctors don't accept
that's a
Medicaid.
specialist,
or
right?
Medicare, whatever it is, subsidized
No, most
insurance.
most most of
Oh,
them
you don't even
don't.
know what you're talking about. This shit
I'm
is
not
crazy.
disagreeing with
I
you.
do know what I'm
So
talking about.
can I say
And that's what's
something real
crazy.
quick?
I know what I'm talking about because
You
I
keep saying
actually am paying for
Medicaid,
it
We are
man.
currently.
different in
So I know
Commonwealth.
exactly what I'm
Me
talking
and you are
about.
different in
You can
Commonwealth.
look
I'll
up
just say
Olivia
that.
Fisher.
There's
You
a
can look up
difference
Scott
between
That's a
Edwards.
Medicaid
You
specialist.
and
can look, I can give
Medi-Cal,
you the
bro,
name of the I
or
can give you the
Medicare,
name
or
of the
whatever it is.
doctors. So you can look up. And they will tell you we do not take welfare
Because
insurance.
There's a lot of doctors that don't take
and this is
welfare
the
insurance,
reason
but
why
there's a
they
lot
don't
that
take it,
do.
because it's
They're
a specialist.
mandated.
And here
Sunshine, you
in the
sound like you're
city,
not far away from your phone.
when you don't have the option, like I'm saying, and you're limited like that, you're not getting the best doctors. Because right now, if you look up Scott Edwards, he's one of the best fertility doctors in the city that people on public assistance do not have access to at all. That's what I am saying is unfair. I'm not saying you don't get a list. I'm not saying they don't give you a choice of doctors, but the best doctors, Olivia Harris, look her up. Scott Edwards, look him up for fertility. I'm going through it now, bro. So I don't understand how you're telling me this shit. I don't understand how you're even opening your mouth to say this shit. For real, because you're wrong at the end of the day. Look these doctors up and they do not take welfare insurance. And even they're not on the list. And that is what's unfair. Is because they're rated very high in success with birth, with IVF, with IUI, with embryo transfer.
Why would that be unfair when it's a free
That's all I'm
service?
saying.
That's like, here's a free car and you pissed because it's not a Bentley. I don't understand.
This
What Troller,
this
It's
nigga got a
what
because
Troller, what
comprehension
Troller,
problem,
what
bro.
it's
It's
the
like
Troller was
really
quality. It's the
saying.
we're talking
quality
now.
that
Let
you
him
This
finish.
receive.
motherfucker is changing. You think by changing the goalpost
Why
that
would
I'm
you do
I'm
that?
losing the fact,
Yeah,
right?
yeah.
But at the end
Don't
of the
play
day,
with
what you're
me.
saying is I looked up the
Don't play
best
with me.
physicians and they don't take
It's not a
Medicare.
toxic
Hey,
Who
situation.
gives
Debbie.
a fuck? What are you talking
Don't
about?
play
They
with me.
have
Keep the
other
seatbelt
good
on.
physicians that take Medicare, and these people that you're naming, they're probably private physicians anyway.
No, they
So
work for the
if their choice
University
not to
of
take Medicare
Pennsylvania,
on
and they
top,
were a part of the
Can I
Pennsylvania
say
doesn't
something?
Medical
matter if they have a
Facility.
Hold
private
on.
They're on
practice.
10th and
If they have
Walnut
a
and on
private practice, they
37th.
still have the choice not to take Medicare.
It's not a
Everybody
private
knows that.
practice. Bro, you don't know what you're talking
Hold on,
about.
hold on, hold
And
on,
this is what
hold
I'm
on, real
trying to
quick.
Man,
tell you.
you
Let
don't
me
know
It's
what
say,
you're
let me
talking
say
okay.
about,
something real
bro.
quick.
You
Hold on,
don't know
look.
what you're talking
Because
about,
you
Hold
man.
can
on.
look
Let me
up
say this.
Olivia Harris
Let me
right
say this
now.
real quick. Hold on.
You're
Let me say this.
confused, man.
Hold on for a second.
I'm tired
Initially,
of
what
talking
Troller
G
was
because
saying.
it doesn't make sense.
What Troller was saying, he was talking about fundamentally women, black women don't take care of themselves. And he was saying there's things that could prevent some of the things that we have issues with. And then he's talking about the fact that you can't be denied care. Now you're talking about the specialists that you can get, but he was ultimately talking about the simple fact that the basic necessities to even look for something, women aren't doing it. They're just accepting whatever is placed in front of them as far as a pamphlet, and they're not even checking. They're just going to go with any process. That's what Troll is saying. Y'all not even taking the basic steps when it comes to the process when during pregnancy. You're taking whatever you're getting, along with the fact that you don't take care of yourself. I was looking at organic things. It said cardiac. It said those things are due to not eating healthy. Mental health issues is the number one reason. Due to suicide and I forgot what the other one was. So don't you think not eating right messes up your decision making skills, make you more irritable? Aren't you more likely to have anxiety and go through a certain type of mental strain when it comes to your hormonal changes? Because you go through hormonal changes monthly. So if you're not eating right, all that shit's gonna be fucked up by the time you decide to have kids. What he's saying is y'all are not even taking basic steps. Now I'm not talking about the woman on the panel. I'm saying the average black woman when she's pregnant, she's not taking care of herself, one, and two, she's not going through the proper procedure. She's not doing it. She's not taking the extra step to find something better. She's not even doing that. And y'all need to admit that part. Admit that part.
And once you get over that, then you can see that there's solutions in that to make the mortality rate go down. It doesn't mean it's going to change any other factors that are quantitative in this situation. Like if there's other factors that's making this happen, that's out of your hand. That's one thing. But if you saying that you can take a list of doctor physicians that are readily available to you, because I know it doesn't matter what kind of insurance you have, you're most likely not going to get the best person in that city or that county that's qualified to do that unless they're because most of them are private physicians. That's common sense. So even right now, I have Blue Cross Blue Shield. I switched to Kaiser. So even with Kaiser, I might not get the best person for the situation, but what I am going to get is a list of qualified people, and from that list, I can pick the best. It doesn't make sense what you're saying. It's like you said that okay, they're going to give you a list of all unqualified doctors. No, they give you
I
a
never
list of
said that.
people,
What
and
I
you need
said
to make
is
a
they
good
give you a
decision.
list.
And what you
They
need to
give
do is
you a
take in that
list.
and that. I'm talking about what
That's
I
not
said.
what
I
I
never
said.
said you said
They
anything.
give
I
you a
never said
list
you
of
said anything. I'm
doctors
talking about what I said. I'm talking about
based
what I
off of
said.
your
So there's no reason for
insurance.
you to cut me off. I'm talking about what I
Oh my
said, not
God.
what you said. I don't
Like, I'm
understand
gonna
why
just
you
let you
can't
be right, because
comprehend.
obviously you gave
Yo,
birth
this
to a
nigga
whole bunch of
retarded, bro.
babies. So I'm gonna just let you be the fuck right, bro. At the end of the
Look,
day, you
at the
right.
end of the day,
I'm
bro,
gonna just
at the
let
end
you
of the
be
day, I'm talking
right.
about what I said, though, homegirl. At the end of the day, what I said, homegirl, is when you get a list of physicians, you can
And if
choose
I'm
the
so much
best
of a
one
fucking
that's
homegirl, then you should
qualified
listen to
for
what the
what
fuck
you're
I'm
going to
saying
get
about giving
done.
birth to fucking babies,
Really,
but you're
it's
not doing that
common sense,
either.
man. Yeah, shut
So it
up,
don't
bro.
matter
Just shut up.
either way you take it. If I'm your fucking
This is
homegirl,
why I
then
don't
listen
like
to what I'm
talking to.
fucking
I don't
telling you
like
about
talking to
birthing a
these people that
motherfucking
be
baby,
on drugs.
bitch.
I can't talk to people on
That's
drugs.
where
They
I'm
be
at.
irrational.
How do you
You're
know more than
irrational, man.
somebody
Extremely
that actually carried a fucking
disrespectful.
baby and went through the
You're
process? But you
irrational,
do.
bro.
But
You're
you do.
irrational.
You're
You're
right.
irrational.
You do. The fuck? I'm starting to think you're fucking trans. At the end of the day, since you got so much information about
Yeah,
carrying
do I'm
babies and
the
the
one that
actual
am I
experience
the
you go
one
through,
behaving like I got mental issues
the
right now, or
fuck?
you are? Which one? Which
It's
one of
not
us is
mental
behaving
issues,
like you can't
bro.
control
It's
yourself?
not mental. You can call it whatever the fuck you want it, but your mental issue is I'ma know it the fuck all when you don't know what it is in Pennsylvania, and that's what I'm trying to
Bro,
tell
I
you.
don't
That
live in
shit varies from
Pennsylvania.
state
We
to
just
state.
telling you to shop around your doctors, you idiot. Like I don't know how hard
I
that
did
is for
shop
you to
around. That's why I got
understand.
the best care, you idiot. You
So
didn't hear what the fuck I
why would
said.
you do it, but you telling other women not to do it, or saying
I
women
didn't
can't
tell
do
them
that in
not to do it.
Pennsylvania? That's
I
fucking
told
nuts.
them what we need to do is fix the disparities and the
You're
availabilities
so rich
based
that
off
you
of
got the best
insurances.
position.
That's what I said. That's what I said.
But that you
That's what
can
I
fix
said.
those things, Kay. You can those things can
You're
be fixed,
stupid,
right?
man.
So let's say if you get an
Dumb.
The
HMO,
fuck?
right? Let's say if you get a government insurance, you can pay more for a government. You can pay money on a government insurance in order for you to get a better insurance or to get more in your insurance. It's like a package. You either go with the
Yeah,
free
but
package
does
No,
or
I
you
PD
agree
either
with
pay the
fix it
you.
extra money
though?
per month. But
I
the thing about it when it
I
comes
agree
to
with you.
fertility, there's only two states that pretty much covers fertility. The only time they will cover a fertility specialist is your doctor. I put in the comments, your doctor has to show proof that it is something that is needed. That
Right.
it's
If it's a high risk pregnancy,
OBGYNs, OBGYNs here in
It has to
Pennsylvania.
come from an OBGYN for insurance. But what I was going to say is that I agree with what everybody is saying and everything else. Like I kind of lost my train of thought. But yeah, everybody right. Like at the end of the day, you do have to do your research. You do have to do your due diligence. Me hopping back on the want to have a baby train. Yeah, 14 years.
Good
Um,
luck. Good luck with that. Good luck.
it is very intense. And what this is in my experience being a bitch that lives in New York City. The fact that we do have Blue Cross Blue Shield, but only reason why we have that is because of the fact that my husband is union, and the insurance that my job offers is just crap. Um, there is a difference. And
Do you have
when I
progeny?
was pregnant with Dion and I was on welfare and I only had a handful of doctors, and these doctors were not the
Mm-hmm.
best doctors, didn't really want to go to these clinics, but I had to choose the best out of the worst evils. It is what it
Right.
is, but I feel like the what it all boils down
that's
to
crazy,
is
bro.
that, I mean, look, that's what the fuck it is here. Like,
Sometimes that's the
and
reality.
Right.
I gotta disagree. I have to disagree a little bit with the Obamacare. From what I understand. The only
Hmm.
doctors that take Obamacare are the ones that work in clinics.
Yeah,
Any of
pretty much.
anything outside of that,
You're
no
not
other
gonna
doctor
you're
is
gonna have
taking
to pay for it out of
Obamacare.
pocket.
They
Right.
will they will
Right.
take Medicaid, and that is the lowest that they will go. But Obamacare in New York City does not walk hand in hand. I'm not quite sure about the state, but there's a couple people who I
Hmm.
know who had Obamacare and they dropped it just to go on Medicaid because they have more
Because you
options
have
with
better chances
doctors.
of getting better doctors on Medicaid
Right.
than with that bullshit ass
Right.
insurance.
So, but
Right.
again, that is from what I know here. I can't speak about anywhere
It's like
else.
that
I
in
can only
Virginia
speak
too.
about my New York experience.
But we're a
Um,
Right.
commonwealth
It's a
on top
state
of
to
that
state
too.
thing. It's a state to
Right,
state thing based
absolutely.
off of the insurance carriers because you might have Blue Cross Blue Shield, but I have Blue Cross Blue Shield and then I have something additional that comes with it called
And I
Progeny.
definitely
And
agree with
Progeny
Troll from the educational
and
aspect that
Progeny actually is what
there is a
pays
need for preventative.
for the
Eighty
specialists,
percent
you
of
know what I'm
those
saying,
deaths
and things
are
like that.
preventable.
Yeah, but see,
Yeah.
And
and I was
fertility,
my husband doesn't need because of the fact that he's a union carpenter, and progeny just comes a part of the package or something like that. They were saying,
right.
but it's just like
And it
it's
covers
like
way more,
it's
yeah.
different. It's different in other what works there doesn't necessarily work here. We're all in different states. Some of our states are red, some of our states are blue. But when it comes down to the health of a woman, of a black woman, when she gets pregnant and everything else like that, all of those things do play a factor. Health, exercising, eating the right things, not spending your whole time being pregnant, just eating junk food, high, all of those things are factors. But when it comes down to the insurance, is where I was disagreeing with because yeah, everybody gets insurance because that's everybody's right. We are Americans; we have right to insurance. But
Right.
when it comes down to where we go and the access that we have, when you don't have
That's where things
money,
get
or
tricky.
when you don't
Yeah.
have, or when you're looking at Medicaid and stuff, you
Or
don't
if you gotta
have the
wait
best
in long,
options
don't
with
forget if that
insurance.
doctor is booked, then you gotta wait 6 months to get a fucking
Yep. Yep.
appointment. That's another
You
mess
have
as
to
Right?
do
well.
that with Blue Cross Blue Shield too. This is the thing though. I had premium insurance every single time. She has one kid. I have two kids, right? So both kids, I had both insurance, good insurance on both kids, right? This is the thing though. We also had bad insurance on both kids. We weighed out our factors. Now I'm telling you, every hospital that I went to, they had a shower, a big ass room, best physicians and possible. We never went into no small ass spot, dirty ass. I shop. We shopped around. We made sure we got the best of the best. Like you
Well,
guys,
which
for
state
some
are you
strange
in, if
reason,
you don't
But
mind
you
me
hold
gotta
on.
asking?
think
I'm in
about states
California.
like
It don't
Mississippi where
matter
they might
where
only
you
have
at,
two
bro. It
hospitals.
It
mattered
does
about the
matter
options
where
that
you're
they.
at.
Oh
Yeah,
It
my
because you
does
God! Can
might
I
matter
have
where
finish
only
this
you're
two
at.
fucking sentence
hospitals
without
in one
paying?
place.
God damn,
It
what's
does
wrong with you?
matter where
Why
you're
every
at.
time you hear my voice, you start talking, man? These motherfuckers
Because
been
I just
talking
hate
this whole time. You ain't said
misinformation.
a fuck shit thing. You don't have. It's not misinformation. If you're in a state and they give you a bunch of medical physicians to go to, and you feel uncomfortable with them, then you have to change. You have to do something to change it. And there's necessary steps that you can do to change it. It don't matter what state you in. What you guys are saying is you just going to whoever the fuck is available to you, which is nonsense. And that's what y'all really did do though. So, and that's what you're saying. You're saying like, okay, boom, I had this insurance, so I just had to go here, which is ridiculous. That's ridiculous. I'm telling you, it don't matter what state you at. That's fucking ridiculous. You guys just didn't do your homework. And that's what I'm saying about black women in general. They don't do their homework. Here you guys are arguing that you don't have access to certain physicians. Cool. You don't have access to those certain positions, but you still have access to a plethora of physicians, no matter where you at. So if you don't like the network that they're giving you, you can change your network no matter what insurance you have anywhere in this country. Literally, there are steps that you can go to change your network. And once you change your network, you should find a physician that you're comfortable with and you're comfortable with their success rate. It's that simple in the network that they give you. It's called the network. You guys not even using the correct words. This is how I know you didn't even do it. You didn't do it though. So that's why you have a problem with it. You just went to the whatever the fuck they gave you, and the first thing that they assigned you to, you went to that doctor and you stuck it out with that doctor. And that's what I'm saying is the issue. Straight across.
It's
But
not
you're
every city. It's not every state. And that's all that we're
Oh my
saying to
fucking
you.
God,
What
man.
worked for you where you are is what worked for you where you are. And again, like I said, don't say that I didn't pay because I have a fertility bill. Matter of fact, okay. And on top of that, I have Blue Cross Blue Shield with Progeny attached. So the problem is when you start to go out of your network here in Pennsylvania, you start to accrue a bill, and baby birth and bills are expensive. So if you're somebody
But it
that is
is.
on
You
public
care about your
assistance
child, you're gonna
insurance,
pay.
Yeah, you gonna
if
pay
you
that
are
money.
on public assistance
You can get a
insurance,
car, but they
you know what
can't
I'm
pay to
saying?
have a child. It's just crazy.
You're
You
gonna
can
have,
This is the other thing. Even if you
oh
have
my
an
goodness.
HMO, if you're using a government HMO, right? there's still other things that like they have like different forms of charity cares that will pick up. So even if you want to go to a private place or your doctor is located within a private hospital, they have stuff that will pick up and pay the bill. You will pay a percentage of it. They will
St.
go based
Jude.
off of your income. They
St.
will go
Jude
based,
does
you
that.
can, yeah, they do that at St. Jude, but they do
Come
that
on,
too
man. Like,
at
what the
private
fuck are these
hospitals.
niggas talking about, bro? This is
Yeah,
crazy, man. You guys are
they do that at
uninformed,
private
bro. You guys trying to
hospitals.
sound informed, but you're uninformed, and the shit that y'all saying is really ridiculous. It's really ridiculous because you know what? When you get a network, you can change your network. You might have to pay copay, you might have to pay something else, but at the end of the day, though, it's your choice to change it. If you just accept what they giving you, that's on you. It's not on nobody else, bro.
But the
If you say if you
conversation
have
is
a
about
doctor,
people that can't
say for
afford to
instance,
go
give
out of the
say for
network.
instance, by some kind
But
of
you
Oh my
crazy
can
ass,
God.
go out of the network though.
you
You
can go
can
out of
go
your
You
out
can go.
of
network
the
no
You
matter
can.
where
I'm
you
network.
not
are.
negating that. You can
You
go
You're
out of the
not
can.
network.
negating that. That's what I've been
But the
saying the whole
problem is,
time.
I'm not
So how are you
negating
not
that.
negating it
I
now?
said healthcare disparities based on wealth. So if you're already on public assistance, you know what I mean, and you go out of your network to
That shit
get
is a
Scott
long
Edwards in
conversation, man.
Pennsylvania
That's all
as your
right.
doctor, how are you going to have money to pay this man? It's not nothing charity
Because you
based.
can
I'm about
challenge.
to pull
You
up
have
my Penn medicine chart and just
Yo,
you
let me
don't
really
ask you a
have
question,
break
to.
down
boss
the
one.
Miss,
numbers.
you don't
Boss
have.
one, do you have
I
any
mean, Kay, you
experience
don't
with
have
having
to.
Medicare? Did you have Medicare when you had a child? Yes or no?
Fuck no.
So what the
Fuck
fuck?
no. And they asked
You have
me
zero
because they
experience in this, but
no, you're
your whole
wrong.
claim to
The re
fame in this whole conversation was that you have experience as giving birth, right? Because you thought because I'm a man, I don't have no experience, but I was there present for both of my child's birth, and I had everything to
that
do
don't mean
with
that you
every
gave
single
birth.
step.
That don't
Yeah,
mean
it
that you
don't matter.
carried
I
the
didn't have
baby.
to give
That
birth
meant
to
you was
know
in a
about the
close
insurance, you
proximity to
idiot.
somebody that was pregnant.
I didn't have to give
What the
birth to know
fuck?
about the insurance. You sound stupid, bro. You sound
I didn't
stupid.
say you
Like I
did.
don't have to give birth to understand insurance or understand selection of medical. Like that don't have anything to do with what we're talking about. I didn't say I gave birth, you idiot. I'm not
Only thing
talking
I'm
about
telling
that.
you is
What
that
the fuck are you
even if
talking
you go
about?
out of your
Like
network
you
here in
trying to
Pennsylvania,
disqualify me
the
because I
bill
didn't
is
give birth
high,
and your ass didn't even use any kind of
and that's not
Medicare.
fair
You have no
because they
experience in
told me
this
they
situation.
I'm gonna be real. When I showed
Zero.
up, me and my wife were black and we were trans, and they automatically assumed, oh, they're on
Oh
welfare
my
insurance.
God.
So
Here we
one of the
go,
first
bro.
things that they said was, we don't take any kind of like welfare insurance or Blue Cross Blue Shield
So
that's
You
attached
should have
to
sued them
there you go.
Keystone.
instantly. You
Yeah,
should have
there you
sued them
go. You got
instantly. That
you
was that
should have
was.
sued them,
You should have
dumbass.
sued the fuck out of
This
them.
is what this
And
is
I
what
said,
happens with our
we
people,
don't
man.
have
They
Keystone.
do shit like
Don't
that to
insult us.
people,
We don't have
and these dudes
Keystone.
are fucking nitwits, and they don't
I
do
think it's
shit
called
about it. And then
Keystone.
they can do it to the next person, and then the next person, and then the next person. This is
Yeah,
the
you
problem
should.
with people,
Yeah,
man.
you
You
should have
fucking
sued
nuts.
them.
Like if they discriminate based on the fact of your gender
And
association
then
or
you should
based
have
on the
walked
fact of your
away.
race, that's a lawsuit, nigga.
Yeah, that
Yeah,
is a
they
lawsuit.
immediately let us know that
This
they
nigga
didn't accept
retarded, bro.
Keystone as the
But
insurance.
you should have. But
And
see, hold on.
Keystone in
Can I say one
Pennsylvania,
thing? I
go
would have
ahead.
questioned them too. The fact that they discriminated against me at the door, I would have been questioning things. I don't think I would have rolled through with them.
Yeah, I would have
Well, it
wanted to
was
be
the
there
clerk,
anyway,
that's
especially if
not
they
the
was
actual
discriminating
doctor.
you
You know how
based
you
on
talk
race.
to the admission people, and when they were collecting the information, they asked us all our information, and they were like, we don't take this Keystone, whatever it's called here in Pennsylvania. And initially,
Whatever
for
it's
our
called.
first round of IVF that we did last year, my wife actually paid that in cash. She didn't utilize her insurance because of the fact that you have 2 full cycles of IVF, and we would have used 1.5 cycles, like harvesting the eggs and stuff. So she just paid for everything outright in cash for it to happen. And now that we have everything harvested, we're using the actual progeny, because it counts as quarter. So with that, you will get 8 tries at a quarter, like a piece, to equate a 2 whole rounds of IVF. So I'm gonna be honest. When they said it, it didn't dawn on me. I just laughed like, I ain't got that shit. My wife's about to pay for this shit in cash, and they was like, oh shit, okay. Doom, doom, doom. Got the cash, harvested the eggs, froze the eggs, made them embryos. They're a month and a half old. I still have 8 left in the refrigerator. And on the 8th of April, I'm actually
Oh,
putting two
this is
eggs
nigga
in.
talking about IVF. This is crazy.
And I mean, but IVF, fertility, all of that, you see fertility specialists and things like that before you even start IVF. And my OBGYN, my regular OBGYN, she doesn't take Keystone either. And they weren't rude and ignorant about telling me. They asked me my insurance. And then when we asked, like, well, do you do, and they were like, no, we don't take Keystone. We don't. And I was like, really? Because at the time we had Cigna, and Cigna actually covered it. So they take a certain version of Cigna. They took Blue Cross Blue Shield, and I think Aetna, and that was it. And that was the University of Pennsylvania, Penn Medicine. So here in Philly, they are ranked one of like the top fertility specialist people, like for lots of things, not even just fertility, for lots of things, even children care, like CHOP and stuff. They're rated very high throughout the country. So that's why we decided to get the care from them. I'm not saying, what I'm saying is if somebody wanted to go see Olivia Harris just to check their coochie out, you know what I mean? Even if they went out of network, they would have to pay some money. And if they're already on subsidized
They
living,
will have to pay a
that's
copay.
a
That's it.
hardship that they shouldn't have to experience just because they want to get primary care. That's all I'm saying.
If they want to
Like,
talk to the best physician, that I'm still gonna look. I'm telling you, even with Blue Cross Blue Shield, even with the Kaiser Permanent, if I
You
want
can
to go
open my
to
door
the
on that
best,
side. You see
if I
my
want to go to the
keys?
best person in this
You open?
county, I might have to pay a copay. If say for instance I have
Gracias.
a
You see
cardio
keys?
problem, right, and I have a problem with my heart, and I want to go talk to the best heart person in the state. Even with good insurance, I'm still not going to be able to get in with that person. That person's probably going to be booked all the way to fuck up. And then another thing, even if I
Mister,
do get in with that person, say if I can get a booking, I'm still going to have
15
to pay
regular.
some form of copay.
yeah, this not my gas
That's a
station.
fact. That's just
but
normal.
I think
That's
that's
like a
why in
normal
Philly,
thing. You're talking about
but
IVF.
I
The
think,
problem is we were talking about regular women giving birth. You're talking about an IVF
no,
clinic, which my ex-wife used to
no,
work. It still
no,
works for an IVF clinic. So like
no.
this is yeah,
Oh my
what the
God.
fuck? Every time I talk, this nigga talks. This shit is nuts. This is retarded. Like it's like you
Because
can't
I'm
control
talking about
yourself.
pregnancy, fertility,
I
and
don't care
IVF.
what you're
I've
talking about.
experienced
I
all
don't
three of
care,
them.
man. You starting to irritate me. You know what? Fuck it. I got my organic,
Yeah.
man. This motherfucker, I'm telling you, you already know. Like, what the fuck? This nigga can't control himself. Control yourself like an adult. That's all I'm asking you to do. Like, the whole conversation went whack because you're sitting there talking about some stupid ass shit. You're literally talking about in vitro fertilization, and these women didn't have to go through that. Normal women don't have to go through that on a regular day basis unless they have pregnancy issues. Like, and then they
But
have to
even
go to
if
those
you don't,
specialists.
you
So if you're
still don't
talking about that, you
qualify. And
don't
that's
even.
what
And
I'm
then
telling
another
you.
problem that I have with this
Oh my God.
conversation is
You know
you
what?
don't
You're
even
so
know
right.
what the Medicare is called in your community. Yet you've been arguing with the whole fucking time that this can't happen because of this, and you have no experience on that, none, and you
Because
still
they
don't
don't
even know
take
what the
it.
insurance is
There's
called.
nothing
Yo,
more
I'm
to know
talking,
than your
I'm talking,
doctor, the
I'm
best
talking,
doctor doesn't
I'm
take
talking,
it.
I'm talking, I'm
Like
talking.
all
You
like
still
you
don't
do.
know what the insurance. You don't know what the insurance is called in
You got it.
Pennsylvania.
You're right. You're right. You're
What is
absolutely
what
right.
is what
And
is the
you're
insurance
right
called
about
in
everything.
Pennsylvania? What
It's
is your low
Keystone.
income insurance called?
I think it's called Keystone.
This is
It's
hey, you see what I'm
Keystone.
saying though, Sunshine Bear? Do you get what I'm saying now? This nigga didn't even know what it was called the whole time. I think it's called Keystone. This motherfucker's been
Yeah,
arguing
it's
this
called
whole fucking
Keystone
time
something.
and don't even know what the shit is
Because
called.
they tell you, the premium doctors tell you that they don't take it. And with that
This
being
is
said, that's
crazy,
the
bro.
reason why you
This
don't have to
is
wait
crazy.
as long to
This was a
see
waste
them.
of argument. This was a
And I
waste of
think that
time,
that's why
really.
they do it, which is wrong. That's wrong. Like, you know what I'm saying? Just because somebody has Keystone doesn't mean that they shouldn't be able to have, premium doctors at their disposal, like somebody with Blue Cross Blue Shield, Progeny, or willing to pay out in cash. That's what my point was. And I've birthed a child regular. I have been through IVF process. I have harvested eggs. I've done a lot of stuff as far as fertility because now, like I said, I'm 42 and my wife is also in her 40s. So we went IVF to freeze the
I'm
eggs,
about to fact
you know
check
what I'm
you though.
saying? So that we
Well,
could
what did you
always
pay
have
out of
babies.
pocket for IVF? Since you paid in cash, what did you
Um,
pay in
the first
Pennsylvania? I'm
round,
gonna look it up.
the first round, the IVF cost me
In
and my wife about
totality,
$37,000.
the whole shit, all over.
In
In totality,
totality, probably about 40,000 in totality. because just for the medication alone, it was about $3,000. The actual cost of the IVF is $15,000, and then we also did a genetic test on our chromosomes to make sure the eggs that they harvested were A's and B's, and that there wasn't any kind of genetic mishap, which can happen in anybody's pregnancy. That's a $10,000 process, and then I mean, we had other like hidden costs, like, oh, you have to stay on medicine longer, or we had additional appointments because of the fact that they want, holding my eggs longer and things like that. We had to pay for all of that. Like, I can pull up my pen medicine chart and show everything that I'm saying down to the number, and they will not cover you if you have Keystone at all, even just to see the OBGYN, because I had to start all my processes with Olivia Harris, which is a regular OBGYN on I think what is it, 8th and Walnut. You know what I'm saying? Downtown and Center City. You know what I mean? And they're not available to the
Sunshine, you
general
doing what
public
I'm
like
doing,
that.
huh? If it gotta fact check you down because you just said some bullshit. You like a lot of
No.
the shit that you said today for sure was uneducated and bullshit. Like you were just saying
Would
anything.
you like me to pull up my chart? I can pull up my chart and show you. Would you
I
like that?
don't I don't want to see your chart, bro. You just saying bullshit,
No, I
bro.
mean,
You didn't even know
would
what
you
the
like to
state
see my pen
insurance
medicine
is,
chart?
man. That okay,
Because it'll
you was
show you
wrong
all
about
the
your state
bills.
insurance. You do know that, right?
What is it? It's not Keystone.
It does no, hold on. I'm about to look it up.
They call it, like welfare insurance. That's how they refer to it as. That's why I'm like, I don't really know what it is because I don't have it, but I know that they don't take it. And I will pull up my chart for anybody and show what I paid for and how we paid for it. The list of medications and things like that. It's not a cheap
Go
thing.
ahead, pull it up.
Like, you know what
You
I'm
might
saying?
as
Like,
well.
nah.
You got empirical
All right, hold
evidence.
on. I'll be right back.
No, don't do that.
Here it go, y'all. Look,
This is what she does
this
sometimes.
shit is
He
not
does.
called that. In Pennsylvania, it's
I
called
don't think he
penny.
has an issue.
It's literally called penny. That's what it's called. And like this is why I was saying from the gate. When you don't know what you're talking about and you just run on and say some stuff, you're
Hold on.
giving
I'm about to text my
misinformation that
cousin
fucks
because
people
I swear to
over.
God that
Like,
shit is
hold on, you
called
giving.
Keystone.
Oh my God, I'm
It's
talking.
Blue Cross
I
Blue
know you hear me
Shield.
fucking. That's it. That's it. That's it. I can't take it no more. I can't do it. I'm just done. You out of here, bitch. No, it's too late. The death rate just went up in this room. Fucking can't control yourself.
Death rate
This
went
nigga
up in.
retarded or something, bro.
He said the death rate went up in this room. Shut the fuck up, Joel.
The mortality rate just went up in this room. Your insurance didn't cover you. No, this whole time this nigga's been arguing about the insurance not covering shit and don't even know what the insurance in Pennsylvania is called. That's fucking crazy.
Yeah.
Don't you see how nuts that is? Like
I
this nigga's been the whole time saying I'm giving misinformation. And I'm telling people it doesn't matter if you have state insurance, right? Which is federally mandated
by
by the
DHS.
government. Yeah, so look, you got state insurance. The state has to provide you with insurance, right? And then they have to provide you with a network. This is just normal shit. In the network, you have a catalog of physicians to choose from. If you, for some strange reason, go down your whole network and still can't find a good one, you can change networks. This motherfucker has a problem with he doesn't even know he don't even know what the state insurance is called, so that's why he doesn't even know what doctors they're provided. He don't know if they're good, bad, ugly, nothing. Some of these physicians take on these state charges. I'm talking about some of the best in your county will take Medi-Cal or Medicare or whatever the fuck it is from it is because that they get more money from that. They get federal funding from that. Like it don't make sense for you to say in certain states they don't do that when federal funding happens in every fucking state. It's called federal funding. What the fuck? It's nuts. Like this motherfucker's trying to tell me something that's really common sense.
Yeah, I was a troll. I was done at when he said that welfare insurance doesn't pay for specialists. and
Yeah,
immediately
that's
I know
fucking
plenty of
crazy.
sisters. Yeah, that's crazy. And then I know the DHS funds the states, and they, they work it out the best way for them. But I looked it up. It says they cover office visits, pregnancy counseling, pharmaceutical coverage for family planning, drugs, IUDs, HPVs, vaccines, and antibiotics for family planning related conditions such as genitourinary infections and sexually transmitted diseases, laboratory services, HIV and STD testing and treatment, genetic counseling and testing, male and female sterilization, breast reproductive and testicular
This shit
cancer
crazy.
screening and education. It's so many
It's
specialist shit on here. I'm done.
Yeah, that shit was crazy. And then it was people agreeing with the dumb shit. I'm like, yo, why are people agreeing with it's people just have the necessary need to fucking say shit that they don't even fucking know about. And it doesn't make sense to me. Like, why do people do this shit? Then the first thing they say is, oh, you're a know-it-all. No, I don't have to know it all. I have experience in this situation. Like, it's just called common sense though, really. Like, most of this shit is common sense. But this motherfucker then turned the conversation into IVF clinics. This nigga the
Yeah.
whole time talking about IVF clinics. Like, what normal woman usually, like, if you go to an IVF clinic, it's because if you're a regular woman who's not transgender or gay or anything like that, it's because you already have experienced problems giving birth naturally or having a child naturally. So now you have to go to a specialist to help you out. Now that's completely, totally different than you shopping around for a doctor to give birth for a regular woman. That's not even in the same conversation. This motherfucker was switching conversations from one thing to the other, thinking that a motherfucker just stupid enough to not understand what you're saying. You're naming doctors that are head of IVF clinics. What the fuck did that have to do with anything? That shit didn't have shit to do with nothing, bro. And then there was women agreeing with this shit, and they'd never been to no IVF clinic a day in their fucking life. Organic.
But there's something I wanted to
But I
understand.
get
Was she
organic light skin, so I don't.
was she well Kay was Kay stating that she said both of them are trans, so that meant her partner is
No,
also
he's a
trans,
that's
right?
a woman
And
that want to be a man, and the wife is a woman that is a man that was a man born a man. So it's like the
Man, yeah,
opposites.
that turned
so
into a
so then
woman. Yeah,
it would be I wanted to ask this question. Then there would be some complications because now you have a man who has
Wisdom.
dropped his testosterone,
I get,
right?
and I'm
In
thinking
order
that's why they
in
had to
order
do IVF to even have a baby because they both were taking hormones. Because that was what I was thinking too. That they probably wouldn't be able to conceive regularly with their bodies having a mix and that hormone, right? Wouldn't that be
and
like a
that's exactly what
conflict?
I was saying though. Like, you are a science experiment. You're not talking about some shit that everyday women have to go through. Like, this motherfucker, when he first started saying this shit, she started saying this shit. She was saying, "Oh, because we have money, we didn't have to experience what other people have to experience because we have so much money." And I'm probably in a different tax bracket. And I said, "That's not real, bro. You
Ain't
lying.
that
The
crazy though,
reason why
Chola, that
the reason why
scientists can
you
even
didn't
do
have
that?
the same experience is because
Crazy.
you're a science experiment.
Yeah,
Hella people wanted to deal with y'all. Like, you got to think about in the medical field. How does it
that's
look
true
on your
too.
jacket
To
to
be able
give
to say
birth
you
to a
could see
transgender?"
babies from transgenders, yeah, that
Exactly.
I did. It's just the
That's
fact that
fucking
science is
ridiculous, man.
able
What
to
the fuck
do
are you talking?
that because
That's
your
definitely a
body,
money
you're
maker.
taking hormones that's telling your
Exactly.
body that you're a man, but you're also putting in eggs to tell your body you're pregnant while simultaneously also being told that it's a man. That's fucking interesting.
No, that's what you didn't hear. See, you didn't hear what this nigga said. This nigga said, because Real asked the question a long, long ass time ago, right? How long before you had to start getting off of the hormones did this
Before the
have to
pregnancy.
start? And it was a year before the pregnancy. So this motherfucker had to go to specialists a year before even getting pregnant itself. And then they had to go to in vitro fertilization specialist to get pregnant. That
So
nigga
you
experience
can't,
is not the same as a traditional woman. This
so you
nigga
wouldn't be
speaking
able to
from
get
a
pregnant with
weird
those
standpoint.
hormones. You would
Yeah,
have to
exactly.
stop
So
the
like,
hormones. So
This
that
nigga
was
That's why
try
I
to
was
tell
gonna
me
the
because
only
I
ask.
didn't
regular
give
way
birth, I
that
don't
we
have no
had
experience. I'm
babies
like,
then.
nigga, I had sex with a regular woman who gave regular birth. You are a fucking weirdo that has sex
Hold
with
on,
another
wait. So let me
weirdo,
understand
and
this
y'all
right,
had to
Troller.
have weirdo birth.
So they have to go back to their regular state before they can conceive.
Yes, yes, that's the
But
whole
can you
point.
go back?
A year
Can you
before
really go
conception.
back? But can you really go back to your normal state? That's why I wanted to ask the question: did you remove your breast? Because I was going to ask questions. How
Yeah, the
do you
breasts
have
are
the
gone.
ability
You
to
can go
lactate?
to their page
No,
if
no, the
you. Yeah,
nigga
the
said
breasts.
he answered that question earlier. He said he don't. There's no way he'll ever be able to lactate. She'll be able
Yeah,
to
there's no
lactate again.
breasts. That those are
Yeah,
gone.
there's
So
no
what
breath. So he,
happens? What happens when you get pregnant? Then
you have to, they had to, they for sure
Yeah,
had to
the
feed their
mama
kid
can't go gorge.
fucking, what's it called? That fucking fake milk.
infant.
What up? What
Yeah.
up? What up?
But don't you need to create hormones in order for the buildup for breast milk? Because you got to tell when you start going through that process of being pregnant,
There's
your breast
probably
is one of the first things that swell.
how much
Yeah,
you
but
want to
then
bet there
there's
has to be
also
a
natural
hormone
women
that they're
that don't
giving them while they're
lactate, though,
pregnant.
Sunshine Bear. There's hella women
That's
in
true.
this country that don't naturally
Yeah, you
lactate
got some women
and
that don't.
don't.
I didn't lactate. I
Yeah.
had to get my lactation after I had my son because it was just not there naturally. Like I didn't do anything to offset it. But my mother was like that, and her mother's was like that as well. I found
Yeah,
out
that's a normal.
afterwards.
That's actually a normal thing. They try to make it seem like
It
I'm
is
gonna tell you. Back in the day, they used to have wet nurses, and in a lot of
because
villages,
every
there
woman
would be
can't
one
lactate.
woman. Yeah,
Right,
there'd be one woman that would breastfeed most of the kids in the village because of that reason. So this shit has been going on since like the beginning of time.
right.
Or they get a
Yeah,
baby's yeast water, pap milk. My
that
grandma
too.
always
That's
talks about
Yeah.
that.
weird. Like women, like especially the type of environment and the women you're around too. Like that shit I learned after offsets it. But yeah, it's been going on for a long time. But yeah, my flow didn't come in until after my son was born. But yeah, that still is interesting. That still is interesting. That yeah, you still have to maintain a lot of emotional aspects of upping the hormones, downing the hormones, and then being pregnant. That's a whole nother set of hormones. Yeah, that's a lot. Ooh, that's a
Well,
lot.
somebody already, I think Kente was the one that said it best. So, with a mother, how the fuck do you feel like you should be able to even converse about some shit that natural women are doing when you didn't even have that experience? And the first thing that you keep yelling over me is, you didn't give birth. And it's like, bitch ass nigga, you didn't give birth either the natural way. You did some weird ass shit. I have more experience with natural shit, the regular shit that everybody else experienced, than you do. I didn't have to give birth to know this shit though. They're like, what the fuck is we're talking about? That shit was stupid. It was irrelevant. And this nigga did some weird ass shit. Like, bro, you had to go to in vitro fertilization. You had to go to a year of fucking doc. You had to go to a year of preparation in order to just fucking I mean, what the fuck is that shit called?
What you
When you
talking
just
about?
impregnate to impregnate yourself.
Seminate.
Yeah, basically.
Artificial
You talking about with the
That's the
semination.
word I was
IV?
looking
Yeah,
for. But
seminate the pregnancy. Yeah,
yeah. Yeah,
that
so
shit ain't no
before
light
she
shit
even got
either.
to
Cause
before she even got to that point,
you know
she
what
had to do a
IVF
whole
troller?
fucking year of
There's hormones
preparation.
you
That shit
take
is
with that
crazy.
too. Like
Yeah.
that
Yeah, you gotta take a
IVF
lot
ain't
of
no light
medicine. People
shit.
going to be in pain.
Yeah,
Yeah,
you have
people
to take a
experience a
lot
lot of
of
pain
fucking
with that.
medicine with that shit. Hell yeah. So that's why I was like, what the fuck? That's a lot
And
of
it can
medicine.
In
Like,
cause
in vitro fertilization.
cancer. Mm.
yeah,
Yeah, that's
IVF.
the thing
That
in
shit ain't no
itself.
light
But then
shit.
you a tranny having given birth with another tranny. Both of you guys got to balance your hormones for a whole fucking year previous to you even going to the IVF clinic. Then you got the year of you doing the IVF. This is a 2-year process damn near just to get pregnant.
With more
But then you're gonna go
hormones.
back to another hormone of taking
Yes.
testosterone when you're already emotionally.
Yes. Yep.
Yeah, and then that's what I want to know. Like after you got pregnant, did you try to go back to being a man? Like what the fuck? And I know, and you know why I think that they be doing that shit too though, because like I said, that shit looks good for the news. It looks good for the doctor. You know that and people get to say, look, this man gave birth. Because I seen on the fucking on
I saw
Instagram
that.
they had like a newspaper the clip that said man gives birth to a healthy baby, and it was really one of these motherfuckers,
It was a Spanish
transgender.
person in 2009.
Yep. So they get a special recognition for doing this shit. So this is why they start helping them people out more than they help the regular person out. So when motherfuckers be like, I have the best of the best physicians because I have so much money, it's like, no, you don't. Stop capping, bro. You got the best of the best physicians because you're a science experiment and everybody wants to be the first. And that's why that nigga shut up when I said that. That's why he got pissed off because it's the truth. You know damn well that's true. You didn't pay for that shit straight out in cash. And then when you look it up in
And
cash, it don't even cost as much as this nigga said it do. No, it's not even close to that. So it's like you just lied, nigga. That's why I was like, I'm gonna start fact checking your dumb ass because you just saying anything now. Paid in
But it's a
cash. Where
play
the fuck
on
you get the
women
cash
too.
from?
It's a play on women too, because then some women start to look at those doctors as like as hope. Like if he could do it for a trans person, he could do it for me too.
But that's like I don't know if y'all
Exactly.
fuck with Jordan Peterson.
They're not gonna do it.
Um, that's why he was let go from his university because they were talking about sciences because they're actually trying to make new sciences to start saying like it makes sense and if a person wants to be trans in this way or they want to go about it this way then this is what it should be medically termed and he went the fuck off and said that he feels like the psychology realm is trying to make a place to okay it to make it okay so that it's not a mental health disorder anymore. And he did a dissertation about it, and they threatened him. It was like, either delete the content, or you're at risk of losing your license. And he stalled them off at first for a little bit, but then they came out again with another paper trying to offset and bring prevalence to trans being able to do those very things. And he went off again. It was like, fuck that, y'all still trying to use psychology as a placeholder to make it okay when we already have it deemed as something that isn't okay, and that there is a mental health capability there per DSM, right? And he got in trouble again and they took his licensing, so now he's coming to the United States. But that's the war he's going through with Canada right now, about that very thing, and about the medical field and psychology and how they're trying to especially with the pronouns. That's another big thing he went off about, was the pronouns and how they were trying to change that, and they wanted to try to add the pronouns to the DSM. So that's been a big battle that's been going on currently with him. But they did let him go and took his licensing out there.